this meeting, and it will be recorded by the council. So anything that we say tonight will be as a record and be broadcast for any areas the council would like to put it out on. I'm just going to ask if we've got any apologies for absence.
Yeah, apologies for absence received from Councillor Peacock.
Any items of urgent business?
No, none, Chair.
Thank you. Right, declarations of interest. I always say my sister's GP in Tottenham and I'm a member of the RCM, but I don't think that'll make any difference to budget tonight. But has anyone got anything they'd like to declare?
Sorry, I'm a councillor on the Bridge Renewal Trust because I know that they bid for some services. So just to put that forward.
Thank you. Any deputations?
No deputations this time.
Thank you. So we've got the minutes, pages 1 to 10. I'm just going to note that the tracker has been now published. We've got a 1 or 2 areas that are outstanding, but the majority have been completed or added to the work programme. Has anyone got any questions on either the minutes or the tracker? No. Okay. I'm going to take that as a no. Obviously, if there's anything that comes up, please let me know. I take this as agreed. Okay. Right. So before we move on to the actual main agenda item, which is scrutiny of the draft budget today, I'm just going to go around and do introductions just so that everyone can know who we are. So I'm Councillor Pippa Connor. I chair the Adults and Health Scrutiny Committee, and I'm going to pass over to Councillor Brennan.
I'm Councillor Brennan. I'm councillor for Muswell Hill.
I'm Councillor Mason, councillor for Bands Green.
Excellent, thank you. I'm just going to check. We've got some members of the committee online tonight. I think Ali, would you like to introduce yourself?
Oh, Ali does have an issue with his mic this evening, so he may not be able to introduce himself. I'm not sure, but if he
just checking to make sure I haven't missed any other members that are on screen. No, anybody? Okay, just checking. To everybody else online tonight, thank you for joining us, and I'm very pleased we've got the sound up, and apologies for the delay to the start of the meeting because of that. Obviously, I'll ask you just to introduce yourself and what position you currently hold in the council when you come on to speak, but I won't do the introductions now if that's all right. So thank you for coming this evening. So we move swiftly on to item 7, which is scrutiny of the 2024-25 draft budget, 5-year medium-term financial strategy. That's on pages 11 to 96 of the agenda pack tonight. So I'm going to go and look straight to Neil. I think you might be introducing this, or Lynn. I'm going to look to either of you. Neil. Okay, excellent. So I hope we've sort of given you the heads up that there's not a long introduction, but it's quite sort of a little oversight of how the adults and health budget sits within the main council budget, and just give us an understanding of where we are on the revenue position and the capital position. And then we'll go straight to the agenda pack and go through the pack this evening. And then we'll spend quite a substantive time at the end on the new saving proposals on Appendix 5, just that people are aware that's where we're going to be spending the time this evening, because those are the recommendations that will go up to overview and scrutiny. Okay, so thank you. And Neil, over to yourself. Thank you.
Thank you, Councillor Connor. In terms of opening remarks, we're looking tonight at the adults and health elements of adult health and communities, and it's can be quite challenging because the overall council's reporting covers a wider area. So that's one context, because any reporting through cabinet, any reporting covers a wider context. So just to bear in mind when you're looking at some of the papers in the pack, it's reported and some of the tables show the whole of adults, health and communities. And obviously what we're removing from that is anything associated with the housing elements or the communities element of the service. So that's to bear in mind when you're looking at any of the tables. The appendices that we have produced in the main for new savings, for growth and for the capital programme set out specifically for adults, social care and for health, excluding anything else. So I did note that the actual savings tracker does include some housing items, but we can direct you through that when we get to those particular items, if you've got any questions about the savings elements. So that's kind of opening remarks about in terms of some of the information we've got in front of you. Hopefully that makes sense. And I'm happy to take questions as we go. In terms of the challenge, obviously, we're obviously facing significant financial pressures in adult social care across the service as a whole. That in year, we're forecasting significant pressures, which we need to try and deal with in going forward. So in year, we're seeing significant pressure on our placement budgets. We're forecasting £20 million overspend, and it's something we've got to try and recognise in future years, because that's not sustainable going forward, because we've seen that position in previous years. So one of the critical contexts we've got to plan for going forward is how do we deal with the position of a budget pressure and actually put the service back in a sustainable footing going forward. So one of the key plans is actually to deal with the growth, which means you're then recognising the real cost of delivering services across adult social care. That's important to recognise, because that's a key challenge, and recognises the pressures of dealing with not only the numbers of vulnerable adults who are supported by the council, but also the cost pressures around in recurring inflation, particularly as in the last year or so we've dealt with the cost of living challenges. So that's some of the key challenges we face within the service. So the budget going forward will deal with some of those particular challenges to try and rectify that situation and bring about a more balanced position in terms of going forward. That's not to say is that savings will still not be identified. There's a savings schedule contained in the appendices, which we'll go through as you've highlighted earlier. So we'll go through that in detail. So significant savings will be identified to try and contribute towards the council's overall target and recognise the financial gap that exists. Should also note that the papers in front of you, the Cabinet report that was considered last Tuesday, on the 5th of December, deals with a progressive position in terms of dealing with the council's financial challenges. So we've made inroads towards delivering a balanced budget. We're not quite there yet, so there's further work that's got to be undertaken to make sure we deliver a balanced budget. So the position you're considering today is dealing with the position we've reached so far in terms of delivering savings and working towards that balanced budget position. So I think it's important to note that this is a budget's in progress. In normal circumstances, we'd have by now reached the position of a balanced budget, but I think we probably all agree we're probably not in normal times in terms of local government finances. We hear too many councils are struggling and reaching the point of having to issue a Section 114 notice. We need to make sure that we don't reach that situation by identifying appropriate savings and find a way to deliver a balanced budget by means that's appropriate to ensure we don't affect the services we're delivering. So that's some of the key challenges in terms of the current in-year position and the current budget strategy going forward. In terms of capital, major significant piece of work has been undertaken already to review the capital programme, because we have to recognise that funding the capital programme is a key element of meeting the revenue challenges we've got. So there's been significant work undertaken over the last 3-4 months to review the shape and size of the capital programme to ensure it's current and relevant for the services we're delivering, things we're aspiring to deliver, but also recognising the affordability in terms of going forward. So we obviously have reviewed that, and the Cabinet report considered a significant change in terms of the structure of that investment over the next 5 years. That's not had a major impact as yet, or significant impact as yet on adult social care to any huge degree. So in terms of the papers contained and the appendices attached to the report, there's no new capital schemes been identified. So it's critical to acknowledge that we have existing schemes in place, and at the moment they remain within the proposals to go forward. I touched on growth, and I think it's important to recognise is that this year's budget for care placement sits about 99 million. We're currently forecast to spend next year something in the order of 126 million. So the appendix sets out our growth assumption, sets out a right sizing or rebalancing of the adult social care budget, but has to recognise that there's many moving parts. So savings will address some of our income challenges and make sure that we'll deal with recovery of income from health partners to ensure that we're recovering health pays for all elements of care that we should pay. So we've got some challenges in there. We have to work more closely, more effectively with health partners. So that's my opening remarks. I'm happy to pick up any points that need to be covered at this point.
Great, thank you very much. Councillor Desneves, did you want an opportunity to say anything right at this moment? Because I know you're here as part of the team, but I just wanted to just give you an opportunity if you want to say anything, or do you want to just come in as you'd like at the end, you know, as questions are progressing?
I will come in if that's okay, but I'll be brief, I promise. So I think I was at the National Care Conference a couple of weeks ago with Beverly and others across the country, and undoubtedly everyone's feeling the pressure of both delivering more services for more people who need more help, but also I think we're all suffering at the hands of what I would call, what actually was described by someone from the conference as the parallel universe in which the government thinks they've reformed everything and given us lots of money, excuse me, which is clearly not the case. So as long as government refuses to engage in true reform of the social care system, which is fundamentally broken, we're going to have these conversations as Neil has introduced, and as long as government doesn't really want to tackle those issues, we can't get beyond that, as I think we've discussed in a recent full council. So the context is, of course, the disaster Liz Truss, there was a Liz Truss inflation debacle, the cost of living crisis, interest rates, etc., and they're affecting not only every single resident and all our vulnerable communities, but also all the people that provide the care and support. So that I think that's an important context, which I think Neil alluded to. In terms of this budget and what's before you tonight, what I'm pleased to say is there's an injection of funds that stabilises, right sizes is the term, although I always think, not sure that means that much to people, but I think stabilises the budget, recognises the growth in demand and the growth in need, and acknowledges that. I think in there is also us within this budget battling for residents' fair share in health, as I think Neil alluded to, and making sure that people are getting what they have a right to and what they deserve. I think we're also in this budget being realistic about what we can achieve, given the circumstances and the challenges. And right before you don't have any significant changes in policy that would worry, that I would hope worry or concern the community, especially those most in need. So I think that's all I was going to say, is set that out. That's what I think's in front of you. And then I'll come in if you need me to. But thank you.
Thank you. And just for the record, Cabinet Member for Adults and Health and Social Care, just
Apologies. Yes, so I am Lucia Desneves and I'm the Cabinet Member for Health, Social Care and Wellbeing. People
might have wondered why I just invited a councillor to come in there as speaker. So that's lovely. Thank you very much. Okay, so I'm going to open, as I said, I'm going to do this bit in three parts. One is just to have a quick conversation and some questions around the sort of the larger numbers that are before us. We're going to go through the papers and look at the tables that we've got when you're addressing the savings and planned growth, etc., in the actual pack. And then we're going to go through the appendices at the end, which has got the MTFS savings tracker. But as I said, mainly concentrating on Appendix 5 with the new revenue savings proposals. So I'm going to take some questions now for those in the room and online. from the panel around the larger questions around the budget, sort of as a, in adults and health as the whole before we concentrate in. So I've got Councillor Brennan and then Councillor Mason.
So I suspect I might have asked this before, but on page 19, where it says we've got the years 2024-25, we've got 19,267. I think this is growth, and then it drops the following year to 7,311. Why the huge drop suddenly? You look at this table at the top of page 19. It's service growth section.
Question. Basically, the 24-25 adjustment is part of that resizing, rebalancing of the budget. So it's getting the adult social care budget back to a balanced position. Thereafter, any further growth is around recognising any further increase in demand or increase in costs. So this is very much putting a significant large investment to try and deal with the large gap we've got just now. Thereafter, it's very much making sure that going forward, we're trying to deal with any new pressures, any new inflation beyond that. So we know we've got a gap just now because we've got a gap of circa 19 million in terms of an overspend in terms of care costs. So very much this adjustment, upfront adjustment for 24-25 is to deal with that major gap. Thereafter is trying to deal with the ongoing new pressures that might arise in 25-26 and years beyond.
I'm just simplifying this for myself to see if I'm correct. So in 24-25, we'll basically be dealing with the big deficit issue, and what we do there will mean that in the following years we don't have those same problems. Is that a simplified version?
That's correct, yeah.
Thank you.
Thank you. Councillor Mason.
Mind if I just ask a follow-up to that? How realistic is it that if you do, if you spend that money in 24-25, that there will not be a continued increased need in 25-26?
These assumptions are based on what we know now. You're right that if we roll forward a year, the position might be different. But based on our current set of assumptions about what we know or expect to happen in 24-25, 25-26 and beyond, that's our best estimate of what we think might happen in terms of needing further growth in terms of deal with numbers of individuals might support as well as increased costs.
Okay, so again, asking a very simple question. So the additional growth in 24-25, that will be added onto the budget for 25-26. And this table just shows you the growth figure. So that figure will be stabilised then in 25-26 with an additional amount for growth.
Right. So
yeah.
So we add that chunk of money on 24-25, then on top of that, we add a further 6 million, then a further 6 million, if that makes sense.
Okay, thank you. So I did have some of my own questions. It was just that was a that just seemed a bit. I needed to ask that. So one of the big issues across the whole piece, and I completely accept the report and what you're saying about the many difficulties we are facing. But one of the key issues is about how realistic any of these savings are. And I know we're going to go through them in detail, but I'd like to have some reassurance around the quality of care, because at the last meeting, we looked at the quality of care in various contracts, and it wasn't the prettiest of pictures. You know, there was quite a lot of challenges, and we know that many of those challenges are because of finance, and that people working in the care sector are very often underpaid. And so I do have I would like to know that the pay of the people who are providing services within the contracted services will be expected to increase in line with general increases of pay, and that we're not anticipating contracts to be driven down to the lowest value possible.
In terms of assumptions around what we pay for care for those who receive domiciliary care or home care, we are then linked to the national or foundation living wage in London. So any payments, we were linked to that. That doesn't necessarily apply to those who care workers who may work in care homes, because we only apply those conditions. So we will have to recognise that any increases or any uplifts are given to providers who provide domiciliary care. We'll have to recognise that we have to build in sufficient increase to cover the increased costs. This is a different situation with care homes, where we're actually not bound by the same agreement, but subject that we still have to work closely with providers to actually agree suitable uplifts, because we have to ensure we have to manage the market in an effective way to ensure those providers are maintained and keep in the market, but also ensure we employ suitably trained and skilled staff in those settings. So we recognise there's a challenge there, because we have to uplift provider costs, but equally we need to ensure we've got recognition of the council challenge as well at the same time, in terms of what we've got available within the financial envelope for adult social care.
Yeah, just to follow up on that, I mean, I think we all appreciate that quality of care is essential, and also appreciate the challenges there are, particularly because of funding issues. But I think that I'd like a bit more information, Councillor Connor, about how we can reassure our residents that the quality of care will not decrease any further and will indeed increase, even though there are costing challenges. We know the whole situation in that market is continually being driven down and down. The salaries are continually driven down and down in that competitive environment.
So thank you. I was going to go to Beverly, but I've had Councillor Desneves come in, and then Beverly, if you, and I know we've got Vicky online as well, but I'll do Councillor Desneves and Beverly on that to reply to that part. Thanks.
Yeah, thanks for the question. I think that if I look through each of the revenue savings proposals, which I think is what we're talking about here, I don't see one there that will impact quality of care in the way that you're describing. Although happy to, if you want to pick out particular ones and say you're concerned around those. We've spent a lot of time, I think, deeply thinking about, back to what my opening point, what's realistic and what's reasonable, because we've discussed many times, I think, before, being realistic and being responsible. So I think what's set out there actually seeks to do the opposite, which is to look at what are the other things that are affecting our budget. So we don't see, for instance, staff reductions here, and we don't see those kinds of what people might term cuts for those reasons. Actually, what we're seeking to do is right size our budget and make sure that we're having fairness from our partners, if I can say it that way, and the right kind of input. I think we've got some continuous improvement projects taking place, and obviously, unfortunately, I was ill for the last session, so I wasn't here. But I think we've seen some significant improvements in some of our areas of work, and that's down to Vicky and the team working very hard to improve services despite the challenges. Of course, it's always a challenge balancing those two things, but and perhaps Vicky, perhaps Beverly wants to come in specifically on any points around care, quality of care.
Thank you. Beverly, can I just ask for clarification? I'm sure you're going to be able to say this quite easily, but we are, as a council, looking, well, we do contractually pay or ask domiciliary and care homes and all those providers to pay London Living Wage, don't we? Just give that reassurance, because I know that that was a big initiative that the council signed up to quite a few years ago now. Thanks.
So thank you, Councillor Desnes, and thank you, Councillor Mason, for the question. If I can probably come to you first. London living wage is paid to all our home care contractors, not care homes. So we commission care homes to provide care, and we assess the needs of individuals that are placed in the care homes, and the appropriate support package is agreed. I want to come back to Councillor Mason about your assurance about quality of care. And as you know, we have the Care Quality Commission who inspects and actually regulates safety and quality according to a number of domains. And we have a principle that we only place in with providers who are good or outstanding. And I think in previous meetings, we've discussed that you may be good at a particular point, but you could slip down. And we also went through then the kind of interventions our commissioning quality assurance team, then what comes into play in terms of that outreach to the provider, working very closely with them to ensure that we meet the needs of residents until they're brought back to that improved position. So that's a publicly available record of the assurance of providers in terms of quality of standards. It's not us just doing our own sort of monitoring, although we have our internal processes, but we've got the Care Quality Commission, the statutory body that reviews. And the other point I just want to make with reference to savings, they're effectively efficiency savings. So basically what we've recognized as a service is that we can work more effectively and more efficiently, whether that's through processes, whether we have a number of tools that we use to assess how well we are doing. And some of that is sort of the benchmarking data. Then we look alongside other authorities with similar sort of statistical demographics. And we look to see how well they're doing in various areas, whether it's mental health, learning disabilities, older people. And it's very much a learning and sharing process. We also have the use of Partners in Care and Health, which is an LGA ADAS organization, which supports us again on that improvement cycle. So I suppose what I'm just trying to say is that we know we've identified areas where we can do things more efficiently and effectively. That does not impact negatively on the quality of care, just to give you that reassurance. And I've talked about the sort of external agencies that are there to safeguard really and make sure that we're doing what we say we are doing.
Okay, we've got a lot to get through tonight, so I'm going to ask if you got a brief
Just really quickly also to reassure on the issue around providers, there's a lot of discussion about that and about making sure providers are sustainable. And in this year, we've spent upwards of £5 million paying provider uplifts. So that's for them to be able to be more sustainable, meet their, of course, they're affected by the cost of living, etc., meet their duties and demands for their staff, etc. So we're not shirking on that. And actually, we work with our neighbours so that we are in tune rather than competing each other out.
That was really interesting to know. Thank you. So,
I'm not able to quickly come back, am I?
yeah,
Very quickly.
Yes.
Yeah, okay. Thanks a lot, everybody. And I do appreciate the amount of work you do, and that, you know, I know from the last meetings we've had that the reports have been very thorough. So thank you for those. I am, though, asking about what our prediction is. And when I looked at the revenue savings proposals, that was one of the things that I was concerned about contracts and how they would be affected. So I think that maybe I will come back to that when we look at the revenue savings. I know at the last meeting there were several providers who we had questions about, and I completely understand the up and down of provision and service provision, but I also understand from a provider's point of view that any reductions or any non-increases, if you like, do have a detrimental impact on the service provision, and that providers need to be supported and continually supported in order to meet their quality targets. And it does need work looking at that. I'm sure you appreciate that completely. But I think it is it is our position and our job as backbench councillors to be scrutinising. And so that's what I'm doing now. Thank you.
I absolutely, sorry, if I could just respond, I have no objection to the scrutiny. That's why we're here. It's the scrutiny panel. But I think just to your last remark around provider increases, you probably be aware about the market sustainability funding that you know, those grants that came from government. And as Councillor Desneves has said, we've passported over 5.5 million to providers in the care sector to support increased costs. I would say our commissioning department has worked really hard, very much on an individual basis. It wasn't a blanket over to you. Looking at the needs of individuals, being very clear to use the right tools to assess what is being spent where in terms of that provider market, and then making the appropriate offer in terms of the increases to providers. Thank you.
Okay, thank you. And I think we'll go through each of the proposals in a little bit more detail later, but thank you. That's been really helpful as a general sort of view about what's going on in that area. Just for Councillor Haran and Councillor Donovan, just would you like to sort of introduce yourselves? We just did the round of inductions earlier, but I'll let you sort of come in now. Thank you.
I'm Sean O'Donovan, councillor for Tottenham Hale, and apologies for lateness.
Hi, I'm Karan, Labour member for Woodside, and my apologies for lateness as well.
And just to let everyone know, and I'm just checking, see if anyone's joined online. I can't see anybody coming in at the moment. Just to let you know, we're going through the larger sort of numbers to begin with at the beginning of the report around setting the scene. Then we're going to go through the report and have a look at some of the tables. And then we're going to go and concentrate particularly on Appendix 5, which is the new revenue saving proposals at the end. So just so that you're aware that's. So I'm going to ask a couple of questions, sort of the larger figures right at the outset. I noticed at 5.9 in the report, and Neil, you mentioned this about Q2 forecast overspend of 20.8 million. And you said that this is acknowledged in the preparation of the draft budget for 2024-25, leading to much higher budget requirements than we forecast in March. So my question to you in finance, really, I suppose, is if the overspend at Q2 is this large at the moment, and I know we're waiting on the government to understand what extra money we're going to be getting, but even with the potential of that coming in, have we got any other ideas of how we could raise that shortfall at the moment? Would we be looking at reserves if the government doesn't step up and give us the extra money that we're obviously going to need at this point? Thank you.
Thank you for that question. Obviously, part of the process in terms of setting a balanced budget is actually working very closely with services across the council to ensure that other savings opportunities are identified where possible. So that process is ongoing. We've had two further rounds, one further round and one round which is actually working through its sort of process just now to identify some additional savings. So that process is ongoing, with the full expectation by end of next week we should be in a position to deliver a balanced budget. That's the best intelligence I have from having a brief discussion with the Director of Finance, John Wallow, this morning. So we're working very hard to ensure we identify other savings, other approaches to managing revenue, looking at the capital programme again, for example, looking at alternative approaches, because we're not necessarily that hopeful that further funding will come from government through further settlements. There's been a policy paper issued which kind of outlined what their sort of thinking would be in terms of financial settlement for local government, and there was no real good news in that, to be honest. So the kind of feeling in terms in the finance community is that probably we're not expecting to see much more at the moment. So we have to work hard ourselves to find the solutions to try and deliver a balanced budget.
Thank you. So we're not looking, so my understanding from your answer is we're looking to the wider council for those other savings, as well as within the Adults and Health Directorate, because obviously there's the figures. Are we looking at using any reserves? I know we're a bit tight on the reserves at the moment, and I know in the Cabinet report it definitely speaks about wanting to increase those reserves. But I was just wondering if at this point, given these figures, that there would be a look to actually use some maybe of dedicated reserves that we could pull from another area.
That's certainly not applying at the moment. The moment we tend to ensure we find new savings. And I think we need to make sure we retain a level of reserves that are appropriate for a council this size. And that's the challenge, because we need to seek a position that we're actually councils still viable, if you want to describe it in terms of private sector language. And we want to make sure we find savings or other ways of trying to manage and close the gap.
Thank you. That's really helpful. And in 5.10 on the report on page 13, and you very clearly say in response to these economic factors, 25.5 million growth has been built into the draft budget and 20.4 million for adult social care. So I'm assuming that's the 2024-25. Yes, 24-25. So if, as what you've just sort of highlighted at the moment, we're not expecting a huge amount of extra money from the government, or maybe from, I don't know if external partners, but where would we, because we need to build this into the base budget, but where would we be finding that money as a council to put into adult social care, to put it into the base budget? So where does this money come from?
This is looking at the council as a whole, because the recognition that the gap, and I think part of the opening remarks was about the gap that adult social care currently has, is that's not sustainable going forward. We need to make sure that's recognised, that to deliver some of the challenges that have been outlined in other questions, we need to find that the service is properly resourced. So that's one side of the equation. The other side of the equation is, as a whole, the council's got to deliver savings to overall deliver a balanced budget. So adults will, as we go on to, identify a number of savings that will actually mitigate some of that increase in effect. So on the one hand, we're investing £25.5 million of growth, but we have to recognise that adults social care has to identify some savings as well. But that then same goes for every other service of the council to deliver a balanced budget. So there's a recognition that we cannot continue with a position where adult social care is overspending to the tune of 15 to 20 million. That's not a realistic position. So we have to find a means to manage that going forward. So the efforts are to ensure we've got not only an overall council balanced budget, but adult social care has a balanced budget as well, because officers and Beverly's team have to be given a fair chance to deliver service against a budget that is realistic.
Thank you. I'm just going to ask Councillor Horan and Councillor Donovan. So we're just sticking to those very sort of high level questions at the moment. We're going to go on to the some more specific panel, adults and health, very, very shortly. But just if you'd like to ask a question about this part of the budget, either capital or revenue at the moment. Okay.
I know we're going to come to the new revenue savings proposals. I was just wondering if I could maybe at this point just go back a little bit and look at the savings for the year that we're currently in, that we're not able to essentially manage to find those savings. So the two big items are under improved commissioning efficiencies, preventing debt build-up, and improve processes and practices. So just on maybe just to talk us a little bit about improved commissioning efficiencies, because this is the one where we've not managed to achieve any form of savings. Just to maybe just give us some of the reasons why, because it's a big amount that we talked about in last year's budget setting, which I'm sure we asked you about as well, because I just want to have some, a bit of information, because going forward, we've got a couple of big savings that you've put forward. I just want to know where we're at with regards to that. Thanks.
Sorry, before you answer that, which are you looking at the medium-term financial savings tracker?
MTFS savings tracker 22-23 to 25-26. So it's the savings tracker for the last 3 years.
So it's Appendix 3.
Yes, appendix.
This the one, yeah.
That one, the coloured one.
Appendix 3, perfect.
Period 6, which comes under 7th February 23, improve commissioning and efficiencies, AHC savings 005.
Thank you. Just in case anybody was listening
Yeah.
and didn't know quite where we were in the papers.
Yeah.
Thank you. That was it. Thanks, Beverly.
Thank you very much for the question. So those were effectively stretch targets. Obviously, there are more detailed commissioning efficiencies in terms of the way we work and commission our support packages. So, for example, we work very much across NCL. DAS has come together with commissioners across NCL to agree pricing for the placements in residential homes, et cetera, so that we can have as much control and be less competitive in terms of placements. That's something that's been long standing. We also review all existing sort of support package, and there was a really intensive exercise this year, not least because we knew that we needed to rationalize the market sustainability funding grant that we needed to passport to providers, but also to look to see that actually we were paying for the right costs. So that 1.3 was really stretch efficiencies that we absolutely could not meet with all other considerations. I think the important point to note that financially we've taken the non-achievables and wrapped it into the MTFS going forward, so that in effect have been either mitigated by newly identified savings or completely written off. And I'm sure we'll come to that when we go through the new savings. Thank you.
Thank you.
Thank you. I wanted to ask about capital expenditure and because I'm looking at the review of the capital programme, removing or deferring a number of schemes, which is on 513, and then picking that up through the report, particularly 8.29, and going on to the schemes where there will be continuation capital. Could you, maybe I've missed it in the report, but could you say where there has been a deferment of capital programmes and how we are managing that, please?
Yeah, I haven't got the detailed table in front of me, but basically the approach we took across the council, and I'll only speak to the sort of the adults and health capital projects, was to put a pause on all capital projects so that we could have an effective review. I don't have to repeat the context in which we're working in with all the increased interest rates, etc. But within the previous capital program, we had put some placeholders, for example, to develop accommodation-based options for people in need of adult social care. So that has been removed. We had had higher figures in for the Osborne Grove nursing home development, predicated on the previous analysis that has been going on for some years in terms of that development. And obviously with the context that I've referred to, the business case has not stacked up in terms of the outcomes we were looking for. So that has not been removed, but what we've done, we're re-looking at a new business case, and therefore we reviewed the commitments downwards. In a previous iteration, there were much higher commitments based on the old business case that is now no longer feasible. So obviously that work continues. I can't remember what else we've taken off.
I could come in. I've got it in front of me.
Okay.
Walgorn Road has obviously come out because that was always dependent on the GLA grant, and that hasn't come forward at the moment. So when that does, then we'll be in a different place. But that continues as it is now as a meanwhile space. And then there's also our plan to take in looking at supported living, but to work with the housing team to do that as part of the existing delivery of housing. Makes a lot of sense. We've got something over here delivering housing. We've got here some needs. How about we bring those two things together? But obviously all in the context of the fact that, like any household, interest rates, etc., inflation mean we have to manage capital projects in a different way than we would have. So in some cases, it might mean that things take longer to develop, but that's just where we're at. And I'd imagine anyone would understand that as being just the circumstances in which we shouldn't be borrowing more than we can deal with really at any one point.
Okay, thank you. And we'll go through, I think, that in a little bit more detail, but just to be really clear, just in case anyone has looked through these papers, we're not looking at the temporary housing information within this report. Some of it's in this report, some of it's been taken out because that's actually going to the Housing Scrutiny Panel Committee to scrutinise alongside all the other housing. So though it falls a small amount now within adults and health, the actual scrutiny of those projects is going to be going to the Housing Committee because obviously that made more sense as far as I've understood it.
And actually, just to clarify, Chair, so for example, in the MTFS, there's a tracker, there's a few items there. They are housing and they sit with Councillor Sarah Williams, not with me. So adults and health sits with me, and the other bits, as you say, are with that other scrutiny panel and the other cabinet member.
Indeed. Okay, I've got, sorry, Councillor Haran, before you go in, is it a follow-up to that question? No. Okay, I'm going to ask a quick question that's a follow-up, and then I'm going to go round. So Councillor Haran and Councillor Brennan. Actually, Councillor Brennan, did you have your hand up first? You were waving at me. Sorry, it's Councillor Brennan, then Councillor Haran. Got to remember my orders. Okay, so just a very quick, just on the capital budget, very briefly, and these are the large figures. So Neil, just for people who might have read and may possibly have read the cabinet papers as the appendices because they're really interested in what's going on. Could you just briefly explain to anyone listening what we mean when we talk about the minimum revenue position when the debt that needs to be repaid by the council, we need to pay a minimum revenue position into that. And then a couple of sentences on the capital financing requirements. That's just to set the big picture. This isn't specifically to do with adults and health, although there's be a small portion within that, but it's just so that people can understand what we mean when the council says it needs to, because the figures are very, very large in the report. I think I'm reading this correctly. I've got this is the first time I've seen it, but capital financing requirement, I think in 2023-24, it looks like I've got a figure of 1.3 billion here, but I'm not sure if the zeros are quite correct. So I was just going to check that with you. Anyway, if you could just quickly just briefly explain what those two are, because I think that's quite important in the capital. And then we'll move swiftly on to scrutiny right back down into adults and health again.
This could be a technical answer, but I'm trying to think of a way to present it. In effect, the MRP or minimum revenue position is effectively equivalent to paying off the debt plus interest. So it makes assumption about the lifespan of an asset and interest assumptions over that lifespan, and that's the debt repayment in effect. So that's an assumption that I think it's in table 8.4. Assumption the MRP for 24-25 is 17.7 million. So that's an assumption we made about the borrowing we've got to make, any existing borrowing, because we obviously have been investing capital spend over a number of years, and that's the assumption of the level of MRP requirement to support the existing capital programme. So that makes sense. The capital financing requirement isn't in effect almost the same thing. It's the same calculation. So something, how much do we need to borrow? So that's making assumptions about our borrowing requirement. So that's a different, slightly different number. So this is making an assumption about our future borrowing needs going forward. I'm not 100% conversant with all capital expenditure areas. So if you require a more specific answer, then I can ask your colleague to
No,
some details on that.
That's fine. It just said at 8.36 in the cabinet paper report, which is one of our appendices. And I just wondered if this figure, I'd misread this figure, or sometimes, the zeros aren't always in, we might have put in another couple. So I just wanted to check, and I'll leave this with you, and you can check on the appendices at 8.36. The 2023-24 I think I've got 1.3 billion, but I'm not sure. And that's what I'm just checking with you.
That is correct. It's 1.3 billion is the capital financing requirement for 23-24, and the minimum MRP for equivalent year is 18.6 million.
To just be put it in layman's terms, is that the amount that we need to find as a council to finance the debt?
Yeah, in effect, the capital financing requirement is to finance all the debt we have accumulated with MRPs that in year position for the capital programme, finance the capital programme.
Thank you. Just thought I'd be, just in case anyone's really interested and wanted to know, because there were such large figures, I thought I'll just ask what that actually meant. Okay, thank you. I've got Councillor Brennan and then Councillor Haran.
Yeah, so my question is, I mean, on the assumption that it's on capital, the capital expenditure again, or capital program. So on the assumption that the capital expenditure that was planned was either to improve service or save money in future years by doing things more, improving how we do things. If we're delaying the capital expenditure, can we be sure that this will not have financial implication on our future budgets?
Just to check, that's Appendix 6. Is that the conversation? Yeah, okay.
So, you want me to go? Yeah. So thanks for the question. So obviously careful consideration about what we needed to defer, but what we're doing in terms of the sort of the accommodation-based options is actually talking to our housing colleagues about the housing delivery program and how we might work more closely together to both meet the needs of our sort of cohort of clients with specific needs, as well as more general housing. So those are the current conversations that are ongoing. Yeah.
Haran?
Thank you. I think the question is probably for Neil, this one. So I think, Neil, one of the reasons why we are in a deficit position, part of it is because of the interest rates and our repayments on our debt because of interest rates. I just want to know what assumptions we've taken for interest rates in the next budget. And maybe the follow-on question to that is, what assumptions have you made for inflation as well for the next budget?
Few good questions. So we're just double check my understanding of the question. So one is about, is that general inflation for the second part? And the first part is about, is that interest in terms of borrowing costs? So just be with us to this, just check the report, because there's certain assumptions we make about future borrowing costs, and obviously those borrowing costs have been significantly increased year on year. There should be some setting, and I'm just trying to reference the report because I'm not absolutely familiar with every single part of the report, is that we make assumptions about future borrowing costs over a period of time. So we know what the current rate, the Bank of England rate, we know what we can borrow in terms of new debt, and we make certain assumptions about projections around that, those levels going forward. So we make certain assumptions about whether that level of interest rate will fall or increase over time. But obviously the indicators for just now is that interest rates will fall in the medium term and hopefully continue to come down. So those assumptions are built in broad terms into the planning assumption in terms of the cost of the capital programme requirement is to set calculate the MRP and then capital financing requirement. So those assumptions are built into a model. I don't know, I'll have to speak to a colleague and find out exactly what assumptions those are, because I don't have them to hand, because we do have a team we deal with particular capital funding. In terms of the second question about general inflation, we have different inflation factors. When we're looking at adult social care, we've made an assumption that a 4% inflation factor has been used across the board for increasing the overall cost of care in the system. So if we're spending, for example, 126 million as terms of forecast, we've assumed that there's about a 4% increase on that cost. So that's been built into our calculations in terms of going forward. So, but other parts of the council reflects assumptions about employee cost inflation in terms of future pay awards and general price inflation in terms of looking at what current levels of for future predictions for CPI and RPI are built into the budget.
Okay, thanks. Is it possible to send us that figure? I mean, the reason I ask is because one of the reasons why I think we sort of struggle, we're in a position we are in today is because of the sudden increase in interest rates, which has obviously impacted on us like everyone else. I just want to have an idea whether we've set a realistic number for the budget going forward and how you've set that. Is that based on what other boroughs are doing or something that we're doing that's different from other boroughs? Maybe that's just something that you can bring to us if the chair is happy with that. Yeah.
If it's acceptable, I can bring a separate answer because I don't have the specifics on that particular one. But you can be reassured our capital team have got a lot of experience in dealing with these challenges, and we've got a robust model in terms of forecasting.
No, that'd be really helpful. Thank you. And yeah, we don't expect you to have all the answers tonight. So, but thank you for that question. And yeah, happy to take a written answer. Councillor Mason.
Just to follow up on that, I think it would be really useful for us to see how the modelling is working because we've obviously got loans now and we will be paying different rates of interest on those loans depending on where we took them out. So I don't know how possible it is to do a rolling year programme so we can see, okay, we're paying back loans at 3%, we'll be taking out loans now at 6%, and what judgments you've used in order to determine what you freeze and what you go forward with. I mean, does that make sense? It makes sense in my own head. Whether I've communicated it properly, I don't know.
It's a very good question around understanding how we finance our capital programme, because you're right, we've got historic debts where we financed some time ago. So we tend to make assumptions about a sort of compound or group sort of interest rates because we've got so many different loans taken at periods of time. But also we're refinancing our debt as well, because we obviously look to ensure we are being as efficient as possible. So you can recognise the fact that if we borrowed something, say 3 or 5 years ago, interest rates were much lower, then it's not in our interest to renew or refinance that. And obviously borrowing now, if we go to the Public Works Loan Board, which is obviously the typical route that local authorities will seek new financing, and obviously interest rates are now higher. So we need to recognise that, and that's built into the assumptions we see in the paper around arriving at the MRP and capital financing requirement.
Thank you. Councillor Desnes.
I just want to add in, I think also what plays all that you're describing plays into then every project has its business case, and that's what tips projects over the edge a little bit. Is it just that no longer works, and in the new context, and what's played into that is our financial contacts, but also that of our partners, what's happening with grants. You know, I mentioned earlier a GLA grant not coming through, etc. All of those things plays in, and it takes a business case, for example, the case of Osborne Grove that was created in 2019, which in a way was not that long ago, but in a way was a very long time ago in some of the assumptions we might make in society and some of our structures, and changes all that. So I think all of that plays together and any project, it's my understanding and belief, but I can only comment in my own portfolio, has its own business case and has to stack up financially, and will have that balance, Kathy, you alluded to, around how it helps us both financially and helps residents versus the cost, etc. So each project has to stack up in its own right. And then, of course, a piece of work is then done around looking across the whole council, and all that plays together in there.
Thank you. So we're going to concentrate specifically now on, you'll be pleased to know, the adults and health actual part of the panel specific material, pages 16 onwards in the report. I'm just going to start off with a couple of questions, but we will be going through this report, just to go through the tables, just to make sure that everyone's really clear what that information is. And just for anyone listening in, I think because that's quite important. But a couple of general questions at the outset of that. I mean, at 6.1, I noted that you said the spend on adults aged 18 to 64 now accounts for 55% of total forecast spend. So we say, whilst nationally the pressure on adult social care budgets for older adults, the greatest pressure in Haringey on the care placement budget comes from the younger adults. So specifically, what are there any plans or any ideas either within the capital budget or the revenue to help with this level of increase of need and support? Because I'm assuming that would obviously have a, you know, the better placements we have in Haringey, I'm assuming hopefully the smaller cost it would be, or you could hope. And then the second question from that, I noticed that previous money is not reoccurring, which is quite at the end on page 17 on the third paragraph down. You say that we have quite a bit of money in, but we can't rely on that, such as lottery funding, etc. But I noted, and we've alluded already to our external partners, that the ICB has signalled that the funding to support hospital discharge will be significantly reduced across 23-24, and I think we had, was that 10 million in 22-23. So have we got anything that is coming up to replace some of these external contributions that we had previously that we know of at the moment, or is that something we're still waiting on? Thank you.
I would say certainly in terms of health funding, that statement's correct. Obviously, there are ongoing conversations because we know we're facing a particularly challenging winter, and that those conversations continue not just in Haringey but across NCL. In terms of the other income, there's no change. We've heard the government announcement, and there was no new money in the autumn statement for us. So no surprises there. In terms of the income from client contributions, I think our improved processes and systems and improved efficiencies have seen more of a positive outcome in terms of the client contributions, that income. So I'm just looking at all the elements within that paragraph. Yeah, that's the information we have at present.
Thank you. And is there anything about different levels of support for those younger adults? Thank you.
Yes, so we know that, as you rightly said, transitions in particular, people turn 18, they come in, fantastic medical advances, they live to a really good age, so that's really positive news. What we recognise is that we need to start working earlier with children's services, even before the age of 14, to support our response to the needs of individuals. So that has been a particular focus of some joint work between children's and adult services, and they also form part of our plans in development going forward to manage those costs, younger people.
Thank you. And just so the panel knows that as one of so we have a joint meeting with Children's, joint scrutiny, and we're looking at that whole area of transitions and that new work that's going on. So just to keep that in your minds for February. Okay, so thank you. So we're now going on to pages 18, the service growth sections 7.40 to 7.43. I think you mean when you say the main report, I think we're alluding to the cabinet report, aren't we, at that? Okay. So I've got a couple of questions actually on these tables. Does anyone else have some specific areas they wanted to ask about, or shall I lead with question? Okay. Right, so 6.3. So I've got the existing growth at table 7.1A, and that we've got 2024-25. The service growth section is for adults is 4.1. And then I've got a new growth table below at 7.2A. You've got the 19.267 extra money resulting. So this is the extra growth that's coming in. So on that first column, the first line at the top, adults and health there. And then we've got the total amount of money that's going to be coming in. So sorry, I was going to ask a question on that bit before we go on to what the total growth is. So the report notes that 12.7 million and 3 million has been added to the base budget at the paragraph down under on page 19 under the table 7.2a. So that leads me to a total of 15.7 million that's been added in 2024. So I just wondered where the extra part was, because we've got the 19.26 million and then we take away the 15.7 million, but it leaves 3.56 million. I couldn't see how that was accounted for in this section. So I'm just, Neil's ready to jump straight in.
I'm dying to answer that question. It's an abstraction of some of the numbers, so it's not everything. So that's why it's slightly confusing, because I've taken some of the elements to arrive at that total 12.7 million, not everything. So obviously the combination of the adjustments have been applied. So we've got existing growth, we've got new growth, we've got savings that have been then adjusted as well. So when you start combining all these elements, then you have a slightly different number. I think what always a challenge is that we've got different numbers presented in different ways. And also to add is that when we're looking here, we're looking at adults, health and communities. And then when you're going to look at the appendices associated with attached to the scrutiny report, they're then only looking at adults and health. So as simple as I think in terms of actually looking at the appendix, I think it's appendix 3, it sets out the growth for adults and health. And that sets out the increase that's proposed as part of the budget process, rather than trying to explain all the differences with the numbers, because it could get quite complicated. So.
Okay, so appendix 4, new revenue growth proposals. So 2024-25 figure, the total is just over 20 million. Is that correct on the figures there? Right. Okay. So a quick question on that. Okay, I think those are the questions I had on those particular slides. I'm going to look to the panel to see if they had anything they wanted any clarification on either table 7.1a, which was the existing service growth, or the next one, which is new growth proposals, but it's the 19.2 million, or whether it's the 7.2c, the total planned growth 24 to 25. We've got the 23.36 million there. Is that the 20 million or is that 23 million at that point?
That's 23.3 million or 23.4 million includes additional growth for temporary accommodation of 3 million. So, yeah.
It's actually 20 if you take out the the temporary accommodation.
Yeah.
Right. Okay. So we'll take that figure as the figure in appendix 4, which is 20.369 for that one. Is there anything anybody wants to ask? Yeah, that's Donovan.
Thanks. On appendix 4, the second line of service growth doesn't have a figure for 24-25, and the third line says connected comms mainstream ? Would you be able to clarify what that means?
Appendix 4, new revenue growth proposals.
So this was previously approved, a growth that was put into the MTFS that was approved last year for 23-24, and for 24-25. The question mark shouldn't be there. Sorry, it's just a legacy of something else. So the moment we're funding connect communities through some other means. So this is ensuring that it's got a proper funding.
I think I'm just going to make a quick recommendation here that, yeah, I read that as comms as well. Could we just have a little bit more information on that? Not now, but, you know, so for that table, I think just because the brevity of information there think makes it a little bit tricky for us to, even if we'd seen it last year, it's just to re-jog our memories. And actually some of the panel members won't have been on the panel last year. So it just helps explain. And also, again, if somebody's actually reading the papers, it's quite nice for them to understand. Thank you. So Councillor Donovan, was that? Yep, Councillor Haram.
Thank you. So just coming back to table 7.1A, which is on page 18. And at the bottom of the table, it makes a couple of assumptions. I'll just read it to you. In 24-25, the adults, health and communities growth is attributed mainly to a growth in the net demographic pressures. I just want to try and understand, unpick that a little bit, because it's not clear to me what that means. And then the next sentence, it says the growth from 24-25 is connected to growth from demographic pressures, inflation and costs of young people transitioning to adulthood. So that's also not clear to me why that is only for years 25, 26 and 26, 27. Why not 24, 25? What's really changed there? It's not, I thought people would, a similar number would transition every year, unless I'm completely mistaken on this.
Thank you for the question. So we're looking at, just double check, table 7.1A.
That's correct. 7.1A, the sort of spiel at the bottom of 7.1A.
So this is existing growth that was built into the existing financial planning that was part of the approved budget for this financial year, making assumptions about this next financial year and subsequent financial years. So this was what we approved back in February to March as part of the budget approval. So this recognised that the service still had pressures, and this was built in. So when you're thinking about how we rebalance the budget, it's taking account of what we plan to include as growth in the terms of budget for it was previously approved, plus new growth. So this term sets out the position is we were already planning to include £9.7 million of growth into adult social care, but also that's not enough to deal with the gap we've got. So it's trying to deal with as much as we could of what we thought was suitable. So that's why it's important to then look at table 7.2A, which then starts to balance that up. So if we've got a gap, we need to add in a further 33.9 million to get an overall balanced position. So that deals with the overall position. So bear in mind, this we're talking about in this particular set of tables, adults, health and community. So it includes those pressures and housing demand as well. So that's why it's critical to look at the overall picture, because it's about recognising the rebalancing, the right sizing of the overall budget position that is faced by adults, health and communities.
Yeah, no, I thank you for that. Thank you for the clarification. That was very helpful. I'm just trying to maybe unpick as to the decision making around. I mean, I can see in 24-25 you've put significant growth in, which then reduces a little bit 25, 26 and 26, 27, looking at that table 7.2A. And I'm just looking at Appendix 4. You can see that you've put some growth in 24-25 in some areas, and then you put growth in other. I'm just trying to understand the reasoning behind. I'm just trying to understand the reasoning. I can see the numbers. I just want to know why you've decided to do it that way.
Bear in mind, this is cumulative investment. So we're investing, to take example, table 7.2A, 19.2 million. We're then adding a further 7.3 million on top of that 19.2 million. So it's recognised as, I think, it's apart from open statements, is we've got a gap to fill now. That gap has been filled by a major increase in funding. So thereafter is we then recognises that once we've done that, we're then dealing with any new pressures, any new increases beyond that from 24, 25, 26 onwards. So having invested, in effect, when you look at table 7.2C, we're investing 23.4 million into adults, health and community. So that's about rebalancing. Thereafter, the 10.1 million is very much about in dealing with those things we expect to happen beyond that in terms of cost pressures and demographic pressures.
Okay, thank you. That was very helpful. Thank you.
Just to bounce back to the previous question about new revenue growth proposals, I'm just noting that this talks about a further 1 million for connected communications here. And of course, there is also an issue about connected communications. So I just wanted to be clear whether it was improving communications or whether it was connected communities.
Just to correct, it's a typo. It should be connected communities, not connected communications. It's an error in the
Okay.
report.
So that's the Connected Communities programme. Thank you.
So thank you. It's really helpful just to sort of sit here and go through the tables. Apologies for anyone sort of who knows all this, but it's really good for us to really get to grips with it and like, ask the questions. So going on from those tables that we've just been looking at, we're going on to the next set of tables, which is existing savings. So that's on page 20. We've got, so at this point, we're ignoring the 2023-24, aren't we? We're going on to the 2024-25 because that line isn't, I think we had the discussion that that wasn't supposed to be in the table. Is that correct?
Just remind me which table you're looking at.
So existing savings on page 20, because here we start at 2023 and then on all the others, well, we do that for 3 slides and then we go back to 24-25 again. I suppose it's included because they were the previous savings, whereas the next set of slides go on to the future savings. Yeah, okay. So we've got the next set of so it's existing savings. So it goes to 2023-24, which is the current, and then we're going on to the next one, which is 24-25. So we've got table existing savings, written off savings at table 7.2, and then we've got a little bit of information about management actions, and then we've got a table on revised existing savings. So I just wanted to ask the panel if they wanted to ask anything specific around those tables. I'll ask a question. So I've got revised savings, which is your final, that's the third one. I'm not sure which table that is, but it's the one under. So you've got 7.2B, and then you've got the next one, and then it goes on to 7.2C, but there's another table under revised existing savings. So we've got revised existing savings of 4.9 this time, and then in 2024, 2.3 million. So that 2.3 million, so I've got that as being made up of the 3067 on 2024-25 minus the 0.7 million at 2024-25 on the next table at 7.2, and then coming down to 2024-25 to 2.367. Is that correct? Okay, so we've got those as existing savings. So plus the new savings, and we've got of 0.5 million is the management action table, which is actually table 7.2C. So at 2024-25, we've got the 0.5 million of that. And then we've got plus policy proposals of 4.89 million, which is the new set of savings that we're going to go on the next page. The new savings 2024-25 of 4.89. So that I've totted that up, and that gives us the total planned savings of 7.75 million pounds for 24-25. Is that correct? So my question to you, obviously, looking at the pressures that we're under, is this a realistic amount of money to actually ask Adults and Health to save, considering you'll also be putting into the base budget that £20 million in, and there's a recognition that there's going to be another 10 million in the next future year. So that's my first question. And then if these savings are not achievable, will they then just not add to a next load of overspend, and then we'll be in a similar position where we're having to make up much larger amounts in the future years?
Thank you for that question. I think obviously there's been a robust approach in terms of savings identification across the council, including adults, health and communities. So the total savings targets, including management actions of 7.75 million, have been rigorously challenged and reviewed. So we believe, though, as it stands, those savings are deliverable. But you're right to highlight the risk that if they're not deliverable, then that will create a pressure in years. So that's something we have to recognise as a challenge and a risk, that any process of savings identification, they will carry risk in terms of delivery. So at the moment, these are the services best, I guess, in terms of what you can deliver going forward.
There's quite a few tables that I just whipped through there. So obviously there's some text underneath. So councillors, Councillor Mason, and then other councillors, if you'd like to ask questions around those tables.
It's just a quick follow-up to your question, which is that we're obviously looking at 22-23 at the moment, and you've given revised existing savings. Are you clear that in 23-24 we can achieve that? Because clearly that will then impact on the 24-25 budget if that isn't met. If the 23-24 savings aren't met, then we've got an impact on 24-25. I think it's the same question that you were asking, Councillor Connor, but one that's just pushing us back to this year and next year.
I think thanks for that question. I think we did discuss those savings that were to be written off or removed from the budget. So those savings, which obviously against the existing savings targets we have, obviously there's a proportion of savings which we identified not deliverable. So touched on those earlier. So those are accounted in terms of our forecasting going forward in terms of planning. So just now, obviously, we assume that adults, health and communities have got savings targets of 6.8 million. Obviously, a proportion of those we've identified are not deliverable. So that's where table 7.2b, we're actually then removing 1.9 of that 6.8 million. So that recognises the non-delivery of those savings in terms of those calculations. So we recognise that we can deliver those. You're right to highlight that obviously if there's any further slippage in that, then that could have implications. Just now is our best estimate is we will deliver the balance of those savings.
Thank you. Any other questions on those tables and the information around that? Okay. Okay, so we're going on to page 23 then, which is the summary revenue budget position, which is a nice large table for everyone to look at. So are there any questions from anyone around? Because obviously these are your base budgets going in, and I think that first line at the top there, and then obviously we're Councillor Haran first, and so he was, and then Councillor Brennan.
Quick one. I think this is probably to Neil as well. Just going forward, I mean, you've supplied a revenue budget position till financial year position 28-29 is a long way down. But I noticed in the last 3 years from 26-27 onwards, you have no projected growth. I just want to know your thoughts on that.
You just can clarify that question.
The table 7.3 summary revenue budget position 2023 to 29. The first row, adult health and communities. So we've got growth in the budget for 23-24, 24-25, 25-26, but then subsequently we don't see any growth. Is that just because we're only putting a projection for 3 years and we're leaving those years after that for another time?
we've made certain assumptions going forward, and I think obviously when you get that far out, 5 years beyond, where it's obviously challenging to make accurate projections. So you're right, so you've highlighted the fact that our health communities remains the same over those 3 periods, where some of the other numbers do change, other service lines do change slightly, but I think we're just reflecting is that we're focusing on is the next 3 years.
Sorry, Councillor Brennan.
I'm just actually interested. You've got the council cash limit. What affects that? The changes in that, because it's sort of, it goes up by 34,000, then it goes up less and less and less. I just wondered how that moves. It's council cash limit after finance. You've got that figure, council cash limit.
I think it's probably just understanding what that is and what, you know, what that relates to in terms
Yeah,
of
yeah,
budget.
yeah. But just explain to me, sorry.
Council cash limit is obviously a summation of the figures above, so it's basically looking at that profile. So it's basically the assumptions about the current cost of services that we arrived at based on various planning assumptions in terms of inflation and growth. So it sets out all the assumptions across all the different service areas. So that's why we arrive at, for example, 24-25 of 318 million is based on that includes the 120.8 million of adults, health and communities in terms of all the growth assumptions we're building in terms of balancing the budget and dealing with any savings assumptions at the same time. So those figures incorporate all the tables we've been discussing previously in terms of growth, savings and adjustments to savings.
No, that's absolutely fine. I'm going to ask a quick question, and it's on the that I noted on this. It says just 2 further down, further savings to be identified. And the only reason I'm bringing this up is because adults and health had the biggest or one of the largest overspend. Well, yes, but pressures on its budget, so overspend. And I noticed in 25, 26 and 26, 27, the further savings to be identified. You've got just over 30 million in 25, 26 and 44 million in 26, 27. Have I read those figures correctly? And but obviously that's across the whole council. Those are the savings, but I do note that obviously because of the pressures on adults and health, I'm quite concerned that that would transpire that adults and health would be asked to make a large amount of savings within that. Am I just jumping the gun on this? Is this something that's come up, or is this something that's in discussion? Because that to me looks like quite a concern.
To arrive at balanced budget, we need to identify further savings. That's the critical factor, is that every department in the council has to identify its share of savings. So you're right to highlight the concern that some of those will certainly fall in adults, health and communities. The challenge would be is about how the council delivers its balanced budget going forward, where every council department contributes to the financial targets.
Well, thank you. We'll come back to that obviously nearer the time. So okay, so thank you. We've got the next couple of tables. We've got 6.4, which is capital now, which is the section 8, if anyone's following on the cabinet papers in the appendices, but on ours it's page 23, 6.4. We've got capital expenditure by directorate, and then we've got financing strategy, and then we're going to move on to the appendices. So has anyone got any questions on the capital that's currently in the tables here?
Just got one quick question, which is about there are no new schemes, but the Edwards Drive scheme is now planned to be delivered by the Housing Delivery and the Burgoyne Road by GLA grant. I know this is a detailed question, but the impact on revenue of that scheme being delivered by housing and the impact of housing benefit on has that all been, I'm assuming you've factored all that in, but because we know housing benefit still exists for supported accommodation, and that's often used to enhance the amount of money that any provider has. So I'm just wondering where that comes from in this new deal with housing. Do they take on the whole of that, or do you in adult social care take that on? Okay, that's fine.
Sorry, we don't have that level of detail at present.
Okay.
We're just sort of exploring what the art of the possible.
Okay, thanks a lot.
Well, thank you for that. I'm just going to ask a clarification point actually on table 8.3. Under the heading General Fund Borrowing, the first one is column is met from General Fund, that's fine. Then you've got self-financing met from savings. What do we mean by that? So if somebody was reading this, what would they understand by met from savings? That's table 8.3 on page 24, the financing strategy.
Thank you for that question. There's a number of ways of approaching financing the capital programme. One is through how we make it through the general fund, and other elements is actually how do we set up a project, a business case, where we actually generate reductions in revenue costs. That actually means it's self-financing. So we undertake something that means we can be more efficient, more effective, and effectively that then allows us to be self-financing as part of the delivery of that project.
What does the term met from savings mean? Do we mean that sorry, it's just that met from savings was a bit curious.
For example, if we've got a major building refurbishment, or we've got plans to refurbish, I think it's examples used at the former civic centre or civic centre. For example, if we then refurbish that and move back into that and vacate other properties, then that will then generate revenue savings of operating those properties, for example.
Okay. Right. It just might need a little further explanation below.
Yeah.
Sorry, it's just that.
It's just an example.
Yeah.
That we have.
No, that example is really helpful. It's just that understanding what that actually meant was really helpful. Thank you. Any other questions on that, on the capital? Right, excellent. So we come to the end of that part of the report. So thank you very much for that. We're now going to go on to the appendices that we've got in our pack. So we've got Appendix 3, which is the Midterm Financial Strategy Saving Tracker. We've actually already had some discussion around this already, but I did say we could come back and ask some further detail if people had anything they wanted to ask at that point. So I'm going to look around to my colleagues and see if there was anything they wanted to ask. So this is 23, 24, the MTFS savings tracker, which we've already discussed. So some have been written off as undeliverable, and I'm assuming those are the ones in red. That's my assumption, yes. And the other ones are ongoing. I wasn't quite sure why we've got an amber. I'm assuming it means there's two parts to this. One's quite detailed and one section isn't. And then you've got an amber rating for that. Is that just like a holding place on the RAG? Because obviously you can't predict right to 2029 or 28 how things are going. So that's just a holding. Okay, so we'll concentrate on the other section, I think. It's probably a bit more useful. Anyone got any questions on the current? Katsingara.
Yeah, I think Appendix 3 probably goes a little bit with the Appendix 5, which is the new revenue savings proposal. But if you come back to Appendix 3, some of them you are carrying forward to next year and beyond, isn't it? So I want to kind of know in total, because I have in Appendix 5, Is there, how many, so what I would like to know is how many savings proposals do we have in total if you carry forward the ones that are existing? I just want to get in my head because we've got the new ones, which is in Appendix 5, but some of these existing ones we're carrying forward, aren't we? Yeah, am I correct in that assumption or not? Yeah. So how many in total do we have in terms of savings proposals for adults' health? What is the total number?
I mean, now.
Yeah.
Or
Oh, no, now that next year plus the ones that we're carrying forward, because the ones in 5 are just are new.
Suppose in this one, you've got the figures.
Yes,
Yeah,
because
so
there's some
I'll
here
say-
that have been carried forward. I assume these figures in, if I show you what I mean, this table here.
Yeah,
You've got stuff that we're doing at the moment. The greens are the one you've achieved. The reds are one that you haven't achieved or partially achieved, some of which you're carrying forward, some of which you're not. So I just want to try and understand, you've decided to carry forward some, but you've rated them at amber. So I just know how many, so within all of this in total, how many do we have? The actual number. And the ones that we are carrying forward, have you rated them, or are they still remaining at amber, red, or green?
so
Maybe I'm not being clear here. So maybe, okay, sorry. Yeah, am I being clear? Yeah, because I just looked, you all look confused, so I was just wondering whether my question was.
I've understood you. I've understood you, Councillor Hara, and it's fine.
So I suppose I'll start with a general explanation. There are some approaches that don't just begin on the 1st of April and end on the 31st of March. So if you look at the sort of, let me use a useful example. We've been working and we've got some outcomes for continuing, well, from ensuring that health pays appropriately for the cost of care, which has started this year. That's an ongoing process. So that's what one I would call is an ongoing process. So when you say how many new ones, you may not want to count that as a new one. I would say that's a continuing process that will take a number of years. Does that make sense?
No, exactly. And that was my question, is that every year you add on to, you remove some, you add some. Yes. I just want to know what the total number of savings that we have from year to year, because that number changes, doesn't it? Yeah. Are we able to know what exactly the number is? I mean,
I think on the Appendix 3, you've got, it looks like 001. I'm not going to say 002 because that's got zeros against it. 003, which is preventative debt build-up for clients and sustainable financial pathways. It's got figures. So I'm assuming that's ongoing. Then we've got contract reviews. That looks like it's ongoing at least till next year anyway, 24-25. And then we'll move, that's it, the ones at zeros. So I think it's, am I correct in just assuming that if they've got figures for 24-25, then that's going to be added to the new, just going as part and parcel of.
Could I say something else as well, Chair, which is that sort of Beverly alluded to it, but just to build on it, sometimes things take longer so they might be red or amber because we're not there yet, but we may well get there by the end of the year, and sometimes things take longer. Sometimes things overperform and sometimes in year we do better. So it's worth noting that. And I suppose sometimes we might carry something on because it's going well and we think we haven't kind of stretched it as much as we could. And I hope that's helpful.
yeah, no, thanks.
Any further questions on that?
Could I just ask for some more detail about the redesign of Russell Road and the modular homes development? Because I understood that was progressing, but it's not.
So we're not.
Sorry, I'm just going to come in and say those ones are,
Yeah.
they're the housing ones that aren't in this panel. They'll go in housing. So unfortunately, they're not in my portfolio.
Thank you. And yet those will be taken over by housing. So you can ask your question. I'm sure they'll take it up for you. Councillor Donovan.
Thanks. It's related to 003, the prevent debt build-up and sustainable financial pathway, where there was a projection of saving 800,000. I mean, it looks as though the saving was 350,000. Next year, its projection is 700, and it seemed you say links into 2 client debt projects. Presumably, point is you may not have saved as much this year as you thought you would, but you're using the experience to try to save some next year.
Yeah. So just for clarity, this is aged debt where our processes haven't been as efficient as they could be. We've made a concerted effort to actually resource legal personnel to support us in terms of aged debt. We've had conversations with another authority which have been very successful in this. And we're working with some legal support to help us address the aged debt. So because this started sort of late this year, we anticipate we won't get as much traction this year, and therefore it continues into next year. And you can see the assumptions we've made in future years.
Okay, thanks. Sorry, did you say aged debt?
Aged debt.
You mean debt of older people?
No.
No,
Sorry.
old debts that were
Okay.
accrued a while ago. And some of it dates to quite significant time ago, I think it's fair to say. And one of the challenges we had was during the pandemic, perhaps our process weren't able to quite implement our processes as well, or we might have chosen not to as well. So that meant we weren't dealing with the finances in the same way as we might have ordinarily. So we do have some quite old debts.
Okay, now it's always helpful to clarify, because again, this is it. We're not finance experts, so it's quite nice just to go through it with a fresh eyes. Okay, so these were the previous MTF savings. So as we've got no further questions on that, I will move on to Appendix 4, which is the new revenue growth proposals. And from my understanding, that the one in a slightly lighter colour at the bottom, demands-led growth, is the new one that is obviously the 16.2 million, which is the money that we've spoken about today, which is the extra money coming into adults and health, and then the other monies subsequently. So anything on Appendix 4? There's not a lot of detail. Anyone got any questions they'd like to ask on that? Okay, well, I think we can take that one as self-explanatory then, and no further questions on that, other than my request, obviously, to have more detail on that up to that point. Is there anything that, Beverly, you wish to say about any of those areas that you particularly want to highlight to us? Or is there anything you wanted to flag up with us at this point in time? No. Okay. Thought I'd just ask. You never know. Right. Okay, so moving swiftly on to Appendix 5. So as Beverly pointed out earlier, it says new revenue savings proposals, but she's also mentioned efficiencies into that title. So we're going to go through these one by one, because these are the bit that we are looking at tonight. Any recommendations we make on these will go up to OSC, and then we'll discuss it at OSC, and it gives obviously officers opportunities to provide extra information if required, and if that's what you're asking for as part of this. So it's not necessarily, you might say, oh, well, we don't agree with this one. You might just think, well, we just like a bit more information if we're not able to hear that tonight. So we're going to start with the 0 to 19 years public health nursing service efficiencies. This proposal to make savings of 300,000 from our existing contract 0 to 19-year-olds, integrated public health services, work with providers, more efficient ways of working, maintaining frontline services office for residents. Any questions particularly pertaining to this proposal? Councillor Mason.
What numbers of people are we talking about who are impacted by this? So when we're looking at 300,000, is that 300 people, or what kind of numbers are they?
They're actually not people that are affected by this, but I'll ask their back office, what we call back office savings. I'll ask Will to give you a bit more detail. He's on the screen, the Director of Public Health.
Yeah, hi there. Will Maylaris here, Director of Public Health. So this refers to health visiting and school nursing. So health visiting is a universal service. So every child who's born in the borough gets access to a series of visits by the health visitors. There were 3,376 children born in Haringey in 2021. And interestingly, and this sort of supports our savings proposal, that is nearly 800 less children than were born 5 years ago, and that's a kind of downward trend. And we see that, for example, in like our school planning. So that will help with our savings because there's less children who need health visitors, albeit the need is kind of higher than ever in our community. So I hope that's answered your question. And the £300,000, just giving an idea of the sort of total value of the contract, is just above £5 million. So it's about 5% of the contract, which is actually less than the sort of percentage change in the population, downward trend in the population.
Okay, thanks, Will. That's really helpful. And actually, that's really useful to get what percentage of that budget that was part of that savings. That puts into a lot more perspective for us. Councillor de Sneves.
I just wanted to say as well, I mean, it's really useful to have the opportunity to talk about it. I think it's really important when we work. This is a service that's provided by the NHS and we commission. And it's just really important when we work with those providers that we apply the same rules we would to ourselves around managing a budget, making sure that also we see providers make savings. They often do that, and so that we also see those translated where possible to us. I think we have that duty in terms of using public funds well, but as Will says, we also are seeing a change in how the usage of those services. So all of the things together, just feels really important to say that we would apply those rules that we would apply to any organisation that kind of we're at a point of recontracting, making sure we're getting best value for public money.
Sorry, can I just really quick? Oh, sorry.
Councillor Mason and then Councillor Dunn.
And so I'm slightly confused now, because I understood from what was being said that the reduction in school numbers meant that there would be the reduction followed that. You are saying that, aren't you?
Yeah, what I'm saying is.
Shall I clarify? Yeah, so there is a reduction in children, not school numbers, but children being born. However, the need, I think, is when we speak to provider, they say the need is higher than ever. So if you look at overall levels of need, those children, particularly in the east of the borough, may need more input from a health visitor. So I think it's a combination of those two things around caseloads, but also, as Councillor de Sneves said, we would look for more efficient ways of delivering the service, how estates are used, back office functions, as we have with our adult social care in-house services. So they both kind of apply, I think.
Sorry, one of the things that always bothers me is when people talk about the east of the borough and the west of the borough, making quite big assumptions about poverty lines across both. And because I represent Bounds Green, which also has got a west and an east in it, I just want to be sure that that doesn't mean that the concentration of resources goes to Tottenham with Wood Green and the east of Bounds Green being left out.
No, you make a really good point. It's very I've oversimplified it. It's a universal service, so everyone will get a visit, and the decision on whether to put extra input in is based on the assessment of that initial visit, regardless of where people live in the borough. Having said that, it is more likely to see the higher needs in those parts of the borough. Thank you.
Thank you for that. And Councillor Donovan.
This particular saving is spread over 2 years. I assume that it's in order to make sure that we maintain frontline services and to give the providers time, the council and the providers time to work on the new contracts.
Yes, that's right. So we will be beginning our discussions with the provider, and there's a sort of notice period of any changes to the contract and the funding. So we can't apply the full amount in the first year from April. The budget hasn't been sort of signed off officially by council budget.
So we can follow up. Okay. So Will, just a very quick question then. So I heard from you it's 5% of the actual budget that's being moved over those 2 years. So what reassurance do you have as the Director of Public Health here in Haringey that when you do contracts, well, you can chip away to it, and then suddenly a little bit, and then that actually tips it over into a contract that's not as sustainable as we thought it was, or not reaching the number of children that we thought it was. Do you get any sort of feedback from in the contracts around whether they still feel that they've fulfilled the services that they've been contracted to do, or have they got any opportunity to come back and say, actually, that made huge amounts of difference because it meant then X? So what's your sort of reassurance to us that there's a robust sort of conversation going on and measurement of service?
We meet with the provider, as we do with all our public health contracts, on a regular basis, and health visiting, there's quite a lot of performance indicators, and actually they're moving in the right direction. So things like the proportion of families that have visited, new birth visit after a year, etc. So we get that consistency, and obviously we're always in dialogue with the provider, so that we try and mitigate any impacts of the changes in the contract.
That's Karen.
Thanks, Will. Can I ask a question about assumptions with regards to the number of births going forward? Do you think that's going to continue to drop, or do you think there's going to be some stabilization? Because I think that will be quite important judgment to have, isn't it, going forward?
Yeah, I don't know the answer. I don't think there's an anticipation they'll go up. I mean, I think the schools and children's team have that forward plan, but I don't think they would. Yeah, I don't know is the answer to that. And we've got a downward trend, but it seems to be sort of flattening out that downward trend. So it's kind of been flat in the last 12 months or so, but historically it's been downward. But I think useful to model that going forward as we look to the kind of future of these services as well. But there's also the sort of the need element, isn't it? That who are those children being born? What are the conditions they're living in? What communities are they from, etc., which also impacts on the level of need and the services that we need to provide.
I think from memory, I was in a recent meeting with the children's team, and there was no anticipation of any growth of that birth rate in the next 10 years. I think that's my memory of what was said.
Okay, so as I said earlier, we're going to, as we go through each one of these, rather than trying to remember any recommendations at the end, has anyone got anything that they wanted to put forward for further information, or have you had the information that you needed this evening on that recommendation around the 0 to 19 years public health nursing service efficiencies? Okay,
I feel a bit uncertain about about how this is going to impact on children or babies being born where the mother is particularly vulnerable, and whether that will be affected or not. Because from what I'm understanding, it's because there'll be a decrease in the number of health visiting hours needed because of the decrease in population. But I just want to be completely reassured that each child or mother who needs that support will get the same support that they need, and that won't change. If I was reassured with that, I'd be fine.
So Will, are you able to give that reassurance or answer some of that?
Yeah, I guess you can never fully mitigate a risk, and with all our contracts we have to work with the provider. We think there will be efficiencies they can make to ensure that they continue to do that, and we have something called the Vulnerable Parent Program, which we've invested in and we're kind of expanding. So I feel confident that we can do that, and we'll put things in place, but that will be subject to how we to our negotiations. And I suppose we would want to assure you that that will happen, and there are other ways of kind of mitigating it, whether you know, contributions for funding from elsewhere, different ways of delivering the service, different skill mix of staff, etc., that we can use.
So, Councillor Mason, are you happy with the reply Will's given, or would you still like to see some further information for this?
Yeah, I understand we can't be precise, but I think you also understand my concern. And so I think that what I'd like to see is some more information about what we're predicting, how we're predicting those reductions, whether it's all population based or whether it, you know, about what the mix might look like. I mean, I'm sure this is just top level and you've got some background information already, so that might serve its purpose if we got that.
So, Will, if that's all right, if you could provide some further information on this, we'll take this forward then. If the panel is happy to, I'll take it forward as one of the items to OSC, but on the condition that we're looking at further information around the concerns raised this evening. So it's not that we want to reject the proposal. It's just that we're looking for further information to clarify how that's being measured and the reassurances given.
Noted. Yeah.
Yeah. Okay. Is everyone happy with that? Okay. Right. So we're going on to sexual health. So through the pandemic and in the following period, we learned that many residents like to access sexual health services from local pharmacies and through online services and testing services, which are less expensive than clinic-based services and achieve good outcomes. So this proposal continues to take the emphasis forward with a shift to self-services and pharmacy options without impacting outcomes for residents, and that's a cost saving of 300,000. So any questions particularly around this? Okay, I've got a question then. So I had to go into a pharmacy recently for something, just get health prescription from over the counter. I have to say, I've never seen queues like it. I went to 4 different pharmacies just because what I was trying to get, they couldn't get it. So I had quite a snapshot, and there was a huge amount of people all queuing for very different services, some for blood pressure, some for immunizations, some for advice around medication. So I know that there's a huge push onto pharmacies providing a lot more services. Is there any, I think the question I'm asking is has anyone sort of looked at the capacity for pharmacies to actually undertake this? Because, I mean, I was waiting sort of 10, 15 minutes to get to the queue to hand in a prescription form, because obviously there's good complexity of case need before me, which before you go in, you'd hand over your prescription or you'd ask a general question. But that was the first time, and I thought, oh, wow, this is really sort of taking off. So that's a good thing, but also just around the, they looked a bit stressed, to be absolutely honest, as they were rushing around trying to deal with everybody. So I'm just wondering about, are we doing anything to sort of look at how pharmacies are actually coping with different tasks that we're making of them?
So just to answer that question, we do something called the pharmaceutical needs assessment every few years, and we just recently updated it. Every borough has to do one, and it found that our pharmacy provision was adequate and appropriate for our population. And I'm in a way, I'm quite pleased that the pharmacies are offering those services. Obviously, it's a busy time of year with vaccinations. We don't normally hear that's the case from residents. They normally find using pharmacies for these sexual health services a good way of accessing services. But yeah, I think we just need to keep on getting feedback from our pharmacies and from our residents about that. So interesting to hear your perspective on that, but it doesn't seem to be something that sort of chimes more broadly.
My question is about the impact on those people who are more vulnerable, particularly vulnerable residents, mental health issues, etc., and of course younger, particularly women who are beginning to use sexual health services. And going to a pharmacy usually means that you have to ask something in public to begin with, at least. And I think that those more vulnerable people will find that more difficult. So I get you're not going to cut the whole service, but have you looked at what the percentage of vulnerable, and I'm including young people in that, and those who are more adept at using different services like online services and walking into a pharmacy and asking for something to do with their sexual health?
Yeah, I can't give you figures, but what we do have is a sexual health strategy and a needs assessment. Are young people one of the risk groups? So we have a young person specific provision in the borough that people can access, which isn't a pharmacy provision. And then, of course, we've got any people can go to sexual health services across London, including in Archway, including in North Middlesex as well. And even when people access the online service, there is kind of screening. It's not a kind of it's not just here, what does the service you want? Lots of quite different questions are asked, and if any red flags are noted, people will be referred on to a face-to-face visit and fed into clinic-based services. So we do have a kind of range of services, but generally what we're finding is that this shift is something that we're just seeing over time. It's a preference for people to move into the majority of people. But yes, we do have those specialist services. The other thing to note is we have a specific community-based outreach service for people from Black and minority ethnic communities, which is really innovative and offers things like HIV testing in a culturally appropriate way. And that's something that we'll be continuing with and won't be impacted by this saving.
So Snev, did you want to say something?
Yeah, I just want to say one of the interesting things that I learnt and have learnt from the team and working in this area is just that people, you're right, people sometimes do feel a bit reticent about going local, but people can go anywhere in London right now, receive a service, and then we pay, so they can make that choice to go somewhere more confidential, away from people they might know, etc. And that offers there all the time. People can go anywhere they like, and then we foot the bill, basically.
So everyone happy with that recommendation to go through it? Thank you. So nothing to OSC for that. The next one, I'm not going to read this one out, it's far too long, which is good because it's more information, but it's on the continuing healthcare, and that's really the budget from our NHS colleagues around care for our residents. So Councillor Brennan.
So I've just got one question on this, but I mean, as you said, I'm really pleased that the savings on adult health and social care seem to be almost uniquely non-invasive. They're not hurting the residents. I think it's really, really good. I just wanted to know what data or proof we have that we can actually make this savings, or that we can actually achieve what we want to achieve. And I can quite see that we should achieve it, and I want us to achieve it. But how have we got proof that it's going to work, past data or anything?
Vicky, hello, do you want to just quickly introduce yourself and then thank you.
Thank you, so apologies. Can you hear me okay?
Yeah, I just want to say thank you because I know you're not well, and I'm not going to betray any confidence as you don't sound very well. So so thank you so much for coming on. But yeah, over to you.
Thank you. Vicky Murphy, Service Director for Adult Social Care. So we've got some fantastic evidence, and I'll be pleased to share it with you in wider detail. The national statistics for continuing healthcare place Haringey and NCL around 26.6 per 100,000 population. The national average is 66.9, and the highest nationally is 396 per 100,000 population. So we're a significant outlier, and we've done a lot of work to get this in place. So we're working with our colleagues in NCL, the DAS group that Beverly sits on, and myself, and we're taking it forward from an NCL 5 borough local authority with a large piece of work. But additionally, we are working collectively in adult social care. We've brought some real specialist people in that are used to dealing with it, and we've got a project team. So there's a lot of work going in this area. And if we think about some of our really high cost placements and care packages, and we're talking really high cost, to get 2 or 3 over the line would achieve this ambition. So we are really, really optimistic that we can achieve this and more. But thank you for your question, and I'd be happy to send out the data if it helps.
Well, thank you. I think it would be fantastic if we could get this extra funding, and I know that you've been working very hard on this. Just a very quick follow-up question from Councillor Brennan. It's really interesting to sort of see where we're at in this process, and I know that there's been a lot of work happening, but really I'm just wondering for residents, if they think to themselves, oh, my relative who I care for at home actually has nursing care needs, and actually I don't think they've been assessed over the years, because we know that there's been quite a pushback on getting continuing healthcare funding. Is there a way that the residents can sort of look to apply for this now, or are you saying this is a work in progress, and until you actually get extra funding in, it's kind of the status quo at the moment?
So thank you, Chair. We brought a training company in, so all social workers, social care assistants are being trained to be part of their assessment process. We've really strengthened the offer internally. Additionally to that, I've been putting things on the council-wide website around how important it is to share, so corporately we have a different view. We will continue to, as part of our care assessment process, ensure that everybody who comes through the service that are new are referred or complete the checklist as part of our processes. Additionally to that, the team that we've brought in, there's another business case going to a corporate meeting on Thursday. We've got one team in, and we're hoping to double it in size so that we can really support every resident with the process of continuing healthcare. We've also got a project manager, as I discussed earlier, who is going through all our costs of placements and identifying those that need to be put forward part way. Because what members may not know is if you get continuing healthcare, there is no contributions towards your care. So it's important that we really support our residents to get this funding if they meet the criteria. Thank you.
Thank you, Vicky. And so really just to note that I know we often look at savings, but actually that's money that we're wanting to get back from our NHS partners. So we're not losing that. That's just other partners funding it. Yeah. Okay. Thank you. So I'm happy with that. Yeah. Anyone? Okay. Excellent. Thank you, Vicky, for that. Moving on to direct payments. So when a person has care and support needs. So this is the delivery around that. Are there any questions on direct payments? Councillor Mason.
Didn't really understand where the saving was in that, because what you're saying is that one option is commissioning a provider directly to provide the care and support at a higher rate. Alternatively, you use direct payment. So is the savings by moving people from direct provision to direct payments?
I think the saving is that when you commission someone, they they're top slicing their money. They're a care provider, so that money goes into their profit. Whereas when you have a direct payment, you have a relationship, and you pay an individual to support you, and you have that direct relationship with them.
So, sorry, there's a tiny follow-up, which is, that's what I was asking really, this is about increasing direct payments basically, which is great.
Yeah.
I understand, and that would be a cheaper method of doing it. One of the issues two issues about direct payments, as we know, are one, people being confident enough to use direct payments and needing support to do that. And I'm assuming that that's been factored in so that those people who are moved will get the support they need. And then secondly, actually managing the situation with different people people who are coming in. And again, that needs some additional support. So I'm assuming, probably rightly, you're nodding, so I think I'm right, that the savings are a balance between the additional support that's needed and the reduction in cost of going to direct payments.
Correct.
Thank you.
Vicky, who's come on.
I was just going to come in on that. Thank you very much, Chair. I was just going to come in about building the support for them. We're strengthening the offer that was previously in place through Disability Action Haringey. So we've tripled the offer so that they can really reach out to those communities and talk to people and support them through the process. We already had an offer. This is about strengthening it further. Thank you.
Thanks, Vicky. I've got Councillor Brennan, then Councillor Donovan.
I just wanted to sort of like make clear in my head that if there's direct payment to the person that needs care, and then they go to a care provider, will it be cheaper for them because there won't be a cut taken off, or will it be the same price that they might use the money in a different way?
So that would defeat the object, really. It would be more expensive if they took the money. They couldn't afford to pay a provider. What people who have direct payments, they have personal assistance. So
I see.
yeah,
I
yeah,
get-
you get me.
Donovan, Kathy, can you take the mic off?
Yes, you've basically answered my question following on from Councillor Mason's her own question. I'm pleased that yes, the offer of disability Haringey, advice Haringey has been strengthened so they can do more work in this area. Presumably, if there are people who, despite all of the support, still aren't happy with direct payments, they can still they've still got the option, or you still have the option of referring them to a provider.
There's always a choice.
So everyone happy with that going forward? Thank you. Okay, so the next one, strength-based working, strength and asset-based approach is, okay, I'm just gonna read all that out. You can read that yourself and let me know any questions on that particular one. Thank you. That's Brennan.
It's the same question that popped into my mind when I saw most of these things. Have we got data that that we will get the money back? Is it already in progress? We've got data that we definitely are making this money, because the idea seems very good, but what's it based on that we will make these savings?
So we do have some client level data and some trends which reflect that despite the challenge in context, the demand, etc., we're actually maintaining the cost of care, largely with older people. I think we heard earlier that younger adults and transitions are a bit different. And we can correlate that to a shift in the way our practitioners support individuals, whether that's with increased use of assistive technology, which is an example of a strength-based approach, pulling down on resources in their community, etc., etc. But really starting from the individual, the person-centered approach, rather than just going for a cashable cost of a support package. How do you work more creatively and innovatively with that individual to actually support very often improved outcomes, but at a lower cost? So we do have some trend graphs that we can share in terms of where we think how we've been doing. And I'm not saying that we can definitely say it's because of that one factor, but I think that sort of trajectory does prove that we're doing some things right.
Yeah, and I think the trajectory is a really positive one, and to increase people's less reliance on and yeah, their ability to govern themselves. But one of the things that I think people need is support. And very often that can come from peers, as we know, but there's a real deficit in the number of support places and groups in certain areas in the borough. I know in my area, in my ward, it's really hard to find any groups for people who need that support. And I've had a number of residents coming forward saying, I'm looking after somebody who is trapped in the home, who, you know, has got Alzheimer's, who's this, that, and the other, and actually supporting the carer. We know that is really important, but there's nowhere for them to go because those services aren't based in that particular locality. Have you done a survey to see where those services are based and where there is a lack, where there are a lack of services, and then looking at how we can fill that gap?
Yeah, so very, very specifically, and the whole sort of issue of informal carers is really, really a priority for us. We have we've got a lead officer who's been doing some consultative work, co-producing outcomes in the 3 localities within the borough, East, West, and Central. We're in the process of collating, because I think you're aware that we're trying to shift to a localities way of working, so that we officers embed ourselves within our communities and localities where people are. So this is a little bit of a research in terms of those sort of informal carers and the supports they will need. We've got some rich information based on those conversations, and we are in the process of looking to see how, with a refreshed carer strategy, we can respond to the issues identified. Vicky, I don't know if you want to say any more, but that's just a summary. There's a lot more detail behind that.
So, Vicky.
Thank you, Chair. So I do think that, particularly with Beverley's presidency and it being the year of the carer, we've really pushed this work this year, and we've had people specifically just on this carer strategy and going out in the communities and talking to people, the investment that we've placed in it. And it's hopeful that not only are we in those communities, but that we're having a carers section within those localities that sat with us. So we'll keep you abreast of all the updates and the information, but things are definitely improving, and the carer surveys that we sent out and the responses, we've even changed the way that we're responding to them. So if an individual's highlighted any issues, they're actually going to receive a letter and a phone call and a meeting, and we're going out into those communities in January and February on a Friday and Saturday with this carers lead, and we're just going to turn things around and do things slightly differently to support the national agenda for carers and really transition where we need to be. And you're aware about the co-production board and the carers that are attending there as well. There's lots of things that are going off, but absolutely, if within those localities we can get the carers forum to co-produce with us what's in those communities, we can look to make sure that we've got equal service offers and we can put them in place. Absolutely. Thank you.
Thank you. Can I just ask that we have more information on that, as you offered? Really, it'd be good to look a bit more deeply at what's being offered and in which areas geographically as well.
Okay,
Thank
thank you. For me, the bit that was interesting for me is because many moons ago, Bridge Renewal Trust, I think it was Bridge Renewal Trust, did a whole thing on going out into all the communities. I remember it was almost street by street and looking at what we actually had as an offer for residents. And so I feel like it's fantastic it's being done, but it's a bit like deja vu. I'm sitting here going, oh, I have. Anyway, so it sounds great that that's actually happening around the carers. The bit that I'm always a little bit nervous about is when we look at our voluntary sector to really support residents who need care, because this is, I think, what comes to the heart of this, but it's people who are at that low level approach, and I think that's what you're asking of the voluntary sector to support and be part of. We all know that the voluntary sector also is struggling and also looks for funding and support in itself. So is there anything, I'm just wondering if we're going to be making possibly a saving with one hand, but then obviously needing to support our voluntary sector with the other hand. So whether it is actually a saving at the end of it. I'm just wondering if you could give me some reassurance. Sorry, either Beverly or Vicky, I don't know who would be best placed. Thanks.
So voluntary sector now sits with Jess Crow. She's the lead director. So I think she'd be best placed to talk to around voluntary sector initiatives, etc. What I can say from our perspective is that we recognise that those preventative offer is really important. People will have heard of Reach and Connect, that sort of support for to reduce, mitigate loneliness, etc., which has been a very successful program. And there are others that are ongoing. But just to say that voluntary sector sits with Jess Crow. Thank you.
So I think if we ask for further information, particularly around, I think it's just the nervousness about asking the voluntary sectors to step up and do a bit more in a very tight financial circumstances that we know we're all in. And it's just, yeah, that figure is just whether we can actually achieve that saving. Councillor de Snebs.
I just want to say also that the other thing that's really good is we finally have a community chest in Haringey. So we've and so we have initiatives that can be funded through that. And I know we've got lots of, for instance, walking groups meeting across the borough. Again, it's about social interaction. It's about keeping physically active. So it's an example of the kinds of things. And that community chest isn't, some of those community initiatives don't cost a huge amount, but they are in a more localized area and people can reach them and without having to travel far across the borough. So I think that is some of the input that is coming into the borough, and some of that is financed alongside the borough partnership and our health colleagues. So it's a recognition again as well of preventative work, etc. So there is activity taking place that should help and support the voluntary sector to help people.
Well, thank you. So we'll, so is that all right if we just...
There's just a tiny addition to that, because I think that those are really good projects and they're really helpful, but there is also a section of people who just, for whatever reason, find it really difficult to access that support, but who are carers for the kind of people that we've been talking about, but who the outcome by supporting the carer, as we've spoken about, would be, it has a really strongly enhanced outcome. And some of that's quite specialist. So just a quick example, I've got 2 adopted children and one of those children is autistic and also suffered a lot of trauma in early childhood. And by meeting with other adoptive carers, we were able to, just on a monthly basis and having a specialist therapeutic support there, we were able to understand and learn and support each other. That would have cost something, but it wouldn't have cost a lot of money, and certainly it was a lot less than any of those young people going back into care, which is what the trajectory might have been without that intervention. So it's those kinds of specialist interventions, but which don't cost a lot compared to what the cost of returning to full care would be. So that's the thing that was in my head, thinking about how that translates into different areas of need.
Okay, so I think we'll finish with that one now because I'm conscious of time. But I think we'll ask for this one a little bit more information with Jess Crow, just to give us a bit more reassurance around the funding for the voluntary sector and whether we, by doing this or looking at how we ask the voluntary sector to step up a bit more, whether we actually might need, how we look at the funding for the voluntary sector to ensure that we're not placing too great a demand upon them. So we'll take that one back to relook at that line in the budget and we'll get the information from Jess to support that. That would be fantastic. So we'll move on to use of public health growth. There's not a lot of information on that. Anyone want to ask any questions? I'm assuming that's Will. Councillor Singharan.
Yeah, just a brief question. All your other savings have got a 0 next to it. This one's very specifically to 292. So I assume there's a formula to this. And so I just want to know how we get to the number 292 and how likely are we to get this uplift?
Yeah, so the reason we can be precise is because when we got this year's public health grant, and the total grant is 22.3 million, I think something like that. I might have got it in front of me, but we got the figures for next year's grant, which you know, the indicative grant, so it's a rise of 292k in the amount the council received from central government, and that 292k will go into sort of broader council priorities, which of course, because it's public health grant, will evidence how they improve public health outcomes for our residents. So there's already things like information, advice, guidance, so people can get support with housing, etc. Some of that's funded through public health grant. Leisure services, there's a real focus on leisure and well-being. But the 292, yeah, that's we're pretty sure of that figure. Obviously, we're hoping we actually get slightly more from central government in the end, but it doesn't seem likely with the sort of autumn statement.
Okay, so happy with that line? I think that was quite self-explanatory from Will. Thank you, Will. Okay, so we've got a supported living review. So I've got a question on that, but I'm just looking to see if anyone's got. Okay, so I'll kick off with this one. So the slight concern that I had on this one was around, whilst I thought the outcome, what you're trying to achieve is great. I think for me, the risk is around whether we've got that provision. So when you say to get their one-to-one care provided, so currently we need to strengthen supported living offer within Haringey. I'm just worried that we don't have that sort of provision, or whether, so we do have that provision, but whether we could increase that level of provision in order to make the savings. So have we got providers or someone who can step up to do that one-to-one care in order to reduce the costs? Because you've got to ensure that people can reside in the community with one-to-one provider delivered in their own homes. This will reduce the cost. But obviously we need the providers in already to be active and have that the people that can provide that one-to-one care. So I'm just seeing what the confidence we have in our the provision for that is. I've got a hand up. Is that Vicky?
I was just going to ask Vicky to come in. Thank you.
Hello, yes. So thank you, Chair. We do have provision for one-to-ones within our communities and to keep people in their own homes. I know that we brought the work earlier on in the year around our reablement service and how we managed to support only pathways that were relevant to adult social care. So that has freed up a lot of capacity in the market for domiciliary care and one-to-ones. So we will be able to facilitate that. At present, we don't have anybody waiting for a care package from any providers at this time.
Well, the other aspect of that is about housing and the number of people who are in severely overcrowded properties, damp properties, etc., which are not suitable. So have we looked at those numbers in relation to the need for or the ability for people to provide supported living at home?
Thank you, Chair. So we've got a few people that we've successfully brought back into communities in supported living housing, and it's important to note that supported living housing is not the same as council housing and getting a support from a council service. So whilst we are working internally with our housing colleagues and looking how we can strengthen that offer, and we have a list of names that people that would benefit from alternative housing, as you mentioned. This is around provider supported living, so it's a different market, and the provider providing a one-to-one care as well. They are slightly two different things. Thank you.
Okay, Vicky, can I just ask on the offer that we're looking to provide, because obviously if this works well, then I'm assuming this is a recurring saving of 300,000 yearly.
So it's to reduce the budget by 300,000. That's correct, Chair. Additionally, we have successfully already facilitated the move back in house to supported living for some of our residents that were outside of the borough, but also some of our most vulnerable inside the borough that were living with parents. There is a few people that have managed to be successful in this area. So I can't say names because obviously, but there is some people that we've been really successful with. Apologies.
Okay, thank you. Any further questions on supported living? Wants to raise? No. So Brennan?
I believe I had the same question. So I think I think I had the exact same question.
Right, so from what I've heard, I mean, I think this one is one that we'll obviously wait and see. This, I don't think this needs to go back for further information because I think we've had the information here tonight. I think it's just a watch on this one to see how this one progresses. You know, we hope that it's positive and it goes well. So we'll keep a watching brief on that, but we don't need to take that on back, I wouldn't have thought. Okay, so service audit. Any questions on service audit? Councillor
Yeah.
Mason.
This feels like it's kind of the same as some of the other savings that are being made, or very similar. And one of the things that, by reducing demand, by working with our voluntary sector, it's just really hard in the voluntary sector to provide that kind of thing. So at Bounds Green Food Banks, just an example, we deliver food parcels to 25 different people who live in the area every week. And that means they also get a visit and a chat with somebody that they know. We are constantly being asked by different public services, including Haringey Council, to add to that number. And we just don't have the facilities to do that, and we don't get any money for doing it. So it puts a huge pressure on community provision and voluntary sector charitable providers to do that. And I think the expectation that we'd be able to continue to do that is really difficult one. So I'm assuming that there isn't or is there a suggestion that there might be some financial support to enable that to continue? Or are you just seeing this as a cost saving?
So thanks for the question. And Vicky, you can come in afterwards. But I suppose service audit. So everyone is entitled to a statutory review annually. And when you do the review, when our practitioners conduct the review, costs may go up or they may go down. Using the same strength-based approaches that we're trying to embed within our work processes, we have seen very often that on review that we can actually identify alternatives to costed care for individuals. So care costs go down. This is very different. I didn't quite understand the example with the food bank. What the review could also do is to maximize the income for a particular individual or family, because very often you can see that the person isn't actually getting the correct benefit. So it's really an opportunity to give that holistic review to see if any change in circumstances. It's important to note that actually care needs can go up. So it could be an increased cost. What we're looking at here is the trends in terms of the net output of those annual reviews. I hope that makes it a little bit clearer, but I don't really see the connection to food banks. Sorry.
The connection was to reduce demand by working with our voluntary sector to deliver low levels of care, support, shopping, cleaning, etc. And so the dependency on community sector or voluntary sector to do that, which is already really strained and doesn't get the financial support it needs. But I guess that is about a referral back to Jess Crow to see if the match that we were talking about before in the reducing the cost in adult social care, and whether there will be a increased finance available to the voluntary sector to enable them to do this increased work. Because the suggestion here is that the voluntary sector would pick up some of that slack.
You could read it like that. I don't think it's around additional costs for the voluntary sector. I think it's really looking at what's available in the community to support individuals and their families. So I
I think it might.
Maybe it's me.
I think it's
I
just the
can't
way
see
it's worded.
Maybe it's the way it's worded.
Well, also got Vicky who's got a hand up. So Vicky, thank you.
Thank you, Chair. And to be fair, there's not always enough room to write as much as what we'd like to share with you in these documents. So the audit review, first and foremost, was around checking what's on the system, what the person's receiving and what's in the support plan. And if there were any differences, and there quite often can be, if a person's reduced the care. And in some cases people had, and we've already overachieved in this area. And that's because it's just like a sense checking. What's on the support plan is actually going in and the person's receiving it. But additionally to that, it was a good opportunity to think about technology, to team up with. Shopping is on there, but that's allowing individuals to order shopping online and be creative and supporting them ourselves. And then there's some work going on around giving people tablets so that people can be more innovative and access things across the communities much more efficiently and effectively. So it has been really successful. And we must remember that when an individual's got care and support, they contribute in most cases to that care and support, and they themselves would also want to see that they could make efficiencies and savings as well as the council. So I can just say that we went to a lady a few months ago that got quite a significant package of care, and she'd been asking for a reduction because she contributed, and we supported her with that based on level of need and her asking us and to access community stuff. So it's not always redirecting to voluntary sector, but being a little bit more creative of what we can do, applying for benefits so they can get a cleaner themselves, so they're not being charged a higher rate, giving them equipment to order shopping, lining them up with communities and services that are available, not just from a voluntary sector, but from communities that develop services themselves. Thank you.
So I had Councillor Horan and then Councillor Donovan. Sorry.
Thank you. Thank you, Vicky. I think you partially answered my question. What I want to know is how you're going to do things differently from what you're doing now, because what Beverly said is there's a statutory responsibility to do an assessment annually. Does a review, does that currently happen? Is that what you're doing now? Because my thoughts, so I'm not sure what exactly that you're going to do differently that will save you 250K, because I'm thinking like if you're going to have to do more, isn't there more cost that you'd have to spend more time, look at things differently? Isn't that a more costly? Well, I mean, maybe you can tell me how exactly you're going to do things differently from what you're doing now to save that money.
So, and I wouldn't say we're there, but certainly we're on a journey to support our practitioners, reviewing officers to work, as I've highlighted earlier, in that strength-based way. So historically, annual review could just be seen as going in, not really doing the in-depth sort of strength-based approach, looking at what's the tech or the benefits maximize, all of that, just really not actually looking to see whether the existing packages is as effective and as efficient as it should be. We've invested quite a bit in training our staff to do things differently, so that this shows the result. And I was talking about the trends in stabilizing the costs that we've particularly seen this year, and hats off to Vicky and her team for really addressing this really robustly. If I went back 4 or 5 years, we wouldn't have worked in this way.
Yeah, I think probably this links to the last question about what's different this year from other years, and I'm pleased that you're talking about a financial review to find out if people are eligible to benefits, because we know about the how many benefits aren't claimed by people, particularly pension credit is a big one, but there's lots of other ones as well. Is that something now that you're going to be looking at, particular the financial review? You may have already answered that.
We have been. It's not that we're going to. We have been. there was, I don't know if it was 18 months, 2 years ago, there was a massive push to get people onto pension credit. And I forget how many millions we supported individuals in the borough to actually access. I could get more details of that. It was a really important initiative, actually.
I suppose part of the answer also is it's a moving feast, isn't it? Because every year we have new people, every year we need to keep reviewing and actually every year we need to be tightening up those processes and improving what we're doing.
Thank you. So for me, this was an interesting one because I felt like that you were doing this already. So I was just a bit surprised to see it as this. I just assumed that this was what was happening because I think we did a bit in Adults and Health about getting the financial review much more efficient a couple of years ago now. And actually, the other bits I assumed, and maybe incorrectly, that we had our community navigators and connected communities that were already sort of coming in and sort of tying into the care package review, which would have sort of been part of that. So maybe I'm incorrect in that.
So I think you're referring to a slightly different efficiency initiative. So financial assessment is when someone first needs care. And what we were doing then, we weren't doing the sort of processing early enough in the pathway. And what we've done now is put it right up front so that it's more efficient in terms. So that was the financial assessment. So I absolutely know what you're talking about. This is not new, the service reviews. As Councillor Desnev said, we learn more as we continue. So we have been doing service reviews for a number. Obviously, we have to do them statutorily. But as our knowledge and our understanding of what the available additional resources are out there, that improves and it supports our trajectory. So, yeah.
Oh, Councillor Brennan.
So as this is an ongoing process, beg your pardon. So this is a realistic savings that we can expect. Yeah.
The short question. Okay, so I think for myself, this is a really interesting piece, and I think whilst I certainly don't need to take it back up to OSC, I think it would be really helpful for the panel just to note that this is happening and for us to take it forward and look at it as the years progress, because I think as you're saying, Beverly, you're continually looking to change, and I think it'd be really interesting to actually get a little bit more information from yourselves about how that is embedded in that sort of, because you're saying you're training all these staff to do this. I think Vicky mentioned going to do all these different, training all these different cohorts of people to achieve this. And obviously you're going to need to keep that going as Councillor Desnev said, as people leave and you get new people in. So I'm assuming there's a particular package now that everyone will go to with all this bit on it. So they will go through each care review and they will go through this process in quite detail. But I think Councillor Ingharan's point about if you do that, the care review might have taken 40 minutes and now might take 2 hours if you're really pushing to look at benefits and everything. So obviously that's a hidden cost because you're now having to have increased staff. So I think for myself, I think it's just really understanding that part of the equation, I think would be really helpful. So, yeah, so I think we'll just sort of put that as forward as a recommendation that we as a panel look at this. So it does, I don't think, unless you've got any, Councillor Mason.
I do have a bit of concern that we've got 3 targets for reduction here, which is all about supporting people to live as independently as possible, all of which are really valid and great suggestions and great work in progress, but that would save almost 1 million. This is 1 million that would save through these projects in the first year in 24-25. I do have a question mark around, and also a question mark around how widespread we're being in terms of moving people into that. I mean, I do come across people almost daily who are really struggling with getting the right support in place and who've got, maybe they don't quite get into the adult social care package, but who are the people that we're talking about that need to remain in the community and could do with a little bit of extra help. But you don't get very far making a referral in, I'm afraid. So yeah, I do have a bit of a struggle around thinking we can make that kind of level of saving.
Okay, so as the panel, would you like to take it as a sort of more general thing that is, as it's a nearly £1 million saving on those 3 approaches, that a bit more evidence and reassurance given to the panel that we can have a look at, and then based on that, I think we'll then take it forward probably as a panel to look at further. But it can go to OSC as that for more information, just because of the amount of savings. If you take that as a whole, what does everyone think? Okay, because I think otherwise tonight, I think we've probably, and I am conscious that Vicky really isn't very well or doesn't sound very well. And I'm just thinking it's, you know, it's very hard to ask us to come up with all the answers this evening. So, okay, so thank you very much. We'll go on to, so on the back, you go to turn over, you thought you finished. No, as a typing bit, which means we've got another 2 to go. So there's mental health service review, the independent review of the mental health service, highlighted significant evidence, support Haringey is a massive outlier for national funding, particularly the ages of 18 to 65. Steps have been taken. So really it's any questions around this? No, Councillor Haran, Councillor Donovan. Yep, Councillor Donovan.
Okay. When we discussed this previously, we were sent an executive summary of the review, which was actually extremely useful to have. Maybe that could be shared with the panel as well.
I don't see why not. Vicky's online. Vicky, is there any reason why we shouldn't be able to share that in the public domain?
That can go out, yeah, it's had everything removed, so anonymise it.
Yeah, the executive summary that we were sent didn't have any client information or anything. It was just a summary.
Indeed, yeah, I don't see why not.
I just wanted to know what steps are being taken to focus on the locality model. Just says steps.
Okay, okay, Councillor Snowes.
Well, it's kind of how long have you got? There's a lot of work taking place. I think Vicky, Beverly alluded earlier to us having 3 kind of locality hubs across the borough, and the idea being that we bring together our staff and we deliver our services in a different kind of model that's a bit more present in the community. I'm not sure, Chair, if I think we've had a few discussions before on the locality model at the in this committee. So perhaps it's something that you'd like to come back to in a future one.
Yes, we do keep a BDR on the locality.
A lot of detail.
There is a lot of detail, and I noticed Vicky had a hand up, but I am loath to make it go through all the. So that's why I went to you, Councillor Snowes. But Vicky.
Just to say, I'd be really happy to support bringing the locality model to scrutiny for you to review, but there is a lot of work. So this is pre-me. Beverly started the locality work 3-4 years ago, and embedding it, and then we got COVID. And this is not just across adults and health, we're talking about social care locality model. So social workers being back in communities, and it's been started a long time ago, but with the level of efficiencies and increased demand, and we're having to be really innovative on how we take things forward, we've had to put a bit of a foot down on the pedal to try and get it embedded so that we can meet the needs of our residents quicker. And that encompasses that the 3 models for social work is in the background. We've identified 3 heads of service for localities. The staff have been separated into localities virtually. The system is now putting things through. So there's a lot of prep work so that nobody slips through the gaps. And that's what we're doing. So we're basically running a dual service without people recognising it until we're physically moving in January into those areas. And then the presence in the communities will be from April next year. So it has been a long time coming. And with the greatest of respect, to ensure that there is no stone uncovered and that there's no risk, we have to do it in stages. There's a fortnightly meeting internally with all heads of service and a lot of collaboration with our partners and in communities around taking this forward. So the carers co-production work was done in localities, and we're slowly going in just to make sure that everybody's on board, and it absolutely will give that greater presence of social work, but then aligned with my colleagues, public health, our connected communities, voluntary sector, carers. It's just a way of really driving a much more in-person approach. And I'm really excited. My voice might not sound excited, but I am really excited to be the one that's taking this forward.
Okay, thank you. Thanks, Vicky, for that run through. That was very informative. I've got Sarah Sutton on the call coming in. So could you just say who you are and yes, then obviously your thoughts. Thank you.
We'll do. Hi, Sarah Sutton, Assistant Director, Partnerships and Communities. So that looks after the Connected Communities team, but also some of the work that we're doing around the borough partnership development, and in particularly in that kind of neighbourhood and locality setting. So just to build on what Vicky said, is we're starting to really see some exciting things happen in the locality setting. So collaborations between health partners, primary care, and social care, and actually we're seeing more localised provision happen in sort of a more organic way than it has before. Beverly and Councillor Dasnev spoke before around Community Chest and some of the Healthy Neighbourhoods programmes that we've got going on. And just to sort of, I suppose, bring it back to some mental health aspects. We have NHS talking therapies now in some more community settings. Some of that will be providing out of hours provision. And actually, I know this is an adults, but there's some of that support available through CAMS and children as well. So through our collaborations, what we're being able to do is take a much more sort of localised approach to the needs of the area, and be able to have an integrated health and social care offer that starts to respond. It does speak to the prevention work that was mentioned earlier, and there's just some really exciting things that are coming out of that haven't been done before. So just to be really tangible, we now have consultant psychologists having virtual clinics with primary care around medicines management for people who have mental health conditions. Now, previously, there was a bit of a cycle of people sort of getting stuck in the loop and maybe escalating to crisis because their medication wasn't optimised and there wasn't direct access to secondary care in the way that we've got it now. So that's just a really tangible example, and we play that out in a locality sense because they are it's geographically based. With the local GPs in the area, and we also have a trusted referral process now from our locality teams, from non-clinical teams being able to refer directly to secondary mental health services. So I just wanted to throw a couple of tangible examples of things that will happen to all contribute to a difference in this space with that much more localised community approach. Thanks.
Okay, thanks, Sarah. So one question that I had, I just wanted to sort of clarify, because obviously I'm assuming this saving will be not so much as assume the connecting up of mental health support locally, but it says focusing on the high cost placements to ensure we're reviewing these costly out-of-borough packages of care and bringing them back into local provision. So my question obviously is, have we got the sort of the high cost placements in borough, well, sort of the high supporting needs in borough, because I'm assuming the high cost is because of the high level of care that's needed. So have we got that in place for these high cost placements to be brought back in? I've got Vicky's hand up. I'm not sure if that's legacy. Okay, Vicky.
So this is a continuation of the good work that started last year, and we already have had the success in this area. So we've brought, I talked about earlier, quite a few people. I don't know if it's quite 10. It's between 7 and 10 back in Borough into supported living for this cohort. So we've already had the success.
So when you say supported living, is that for people with mental health issues? Right, okay. And have we got further provision? Because obviously we know it takes some time to get these sort of placements set up. Have we got that further provision? Because you're saying you've done 7 already.
Yeah, so there's 2 strands to this. We're working with our colleagues in housing about looking what services they've got in respect to 1-bedded and adequate housing for people that have lower level supported needs. So that might be that we provide a base level or some one-to-one support. The second strand is a provider one-to-one, which is where a provider brings in the property and the wraparound care, 2 different alternatives to providing this, and that would depend on the level of need that they had. So we're working with housing for one, and we're working with providers in the other hand, 2 sets of work. Yeah.
Okay, so that's fine. So I was just checking that we have confidence in that the provider provision is actually in place. Okay, thank you. In which case then, anybody want to bring anything else up regarding that? No? Okay, thank you very much. We've got the grant review is the final one. Better Care Fund external review taking place, work undertaken with the ICB, NHS England, and I'm assuming it's trying to bring in money.
All right. I'm going to read you some text that might be more useful than one that you have in front of you. For some reason, it does not appear that you have the correct text in front of you. And that's probably why it feels like you can't make sense of it. I'm not sure why that's happened, but perhaps the team will pick up that. So I'll just read you what I have. The Better Care Fund is a national funding stream to support health and social care integration. A BSF, Better Care Fund external review has taken place and work's underway with the Integrated Care Board and NHS England in redesigning our Better Care Fund for 23-24. Haringey has about 7.8 million within the plan, and we're looking at opportunities to redirect some of the spend from the wider system back into adult social care.
I think we did have the right thing. I probably was paraphrasing incorrectly. So I
Well,
think
it's just the thing that I've got in front of me here printed doesn't have,
okay.
doesn't seem like
I
the
think
right
there were
thing.
bits, but thank you. So is there anything that we wanted to ask around the Better Care Fund that's looking? Yes. Yes, okay. So I suppose the risk is because it's, you know, it's a review undertaken with the ICB, and we all know how difficult it is getting money. So I suppose the risk to that is through no fault of our own, we just might not get that extra support, Beverly.
That's a risk, but I mean, I know Vicky's there. I don't want to make her talk more, but I think the point is that the Better Care Fund and the I Better Care Fund are they both have defined purposes. So I think that I think there's a possibility on the table for us to think about how that's used together. It's not we should have a strong say in that.
Okay, I'm happy with that. Yeah, I was going to say good luck with negotiations on Neil.
Point of clarity, the 7.8 million is our share of the Better Care Fund. So it's repurposing or reusing our share of the Better Care Fund. So it doesn't rely on the ICB as directly. So it's our actual share of the overall Better Care Fund.
Okay, sorry, I had misread that then. Okay, so it's when it says then, so were we spending it in other areas other than adult social care? Were we spending it in, so when we're redirecting it into adult social care, where were we spending it before?
we have a variety of investments across we use the Better Care Fund for, and obviously we're looking to the review has identified opportunities to redirect that back into adult social care to offset some of the financial pressures. So that's where the £200,000 saving comes from.
Okay, so I think I'm still a bit sorry, wasn't.
It's probably better if we send you a written response around the ongoing review and how the money is actually used. I suppose I'm conscious of the time and yeah, thank you.
It's just that I didn't know where it was, because I assumed it was just for adult social care, so I didn't know that money had been spent elsewhere in the Better Care Fund. So that would be really helpful to get that information. Okay, so we'll take that information, we'll take that to OSC, but just for information so we can understand what's going on with that. So we've got those as the recommendations going up to OSC. That's clear. So there's two other areas that I mentioned to the panel before we started. It's recommendations around the overall paper, because we've been looking at how we present the how the revenue and the capital information is presented to panels. So it's really to get your feedback if there's anything you would like changed on the way that the information was presented, not presented, obviously presented in the pack, not verbally presented, but just the information within the pack, where there was areas that you felt were, absolutely fine and clear, or whether there's areas you felt could, just need a bit more information on.
I think that there were, I think it was really good. Lots of great information. The only single thing I'd say is in all these tables, I think it might be useful just to do a brief introduction, just to say how they relate to each other. Because it did slot into my head eventually, but it was only after I'd read them 2 or 3 times. So just, yeah, that's all I'd say is a little introduction as to how the tables relate to each other. Thank you.
Thank you. I think there is some linking in there. I think there's some pulling out of what the information means in those tables, which is really helpful. But it's that linking bit I also found that would again be really helpful. But this is a learning curve. We're all, looking to improve every time. So it's, this shouldn't be taken as a criticism. This is just how we approach it and then how we sort of look to improve. And then the bit for me was just a bit more information around the explanation around the capital budget. And just really getting to grips with some of the terms and what that impact has if we're paying high rates of interest, what that actually means for us in terms of the revenue, the costs of the revenue. So those were the 2 particular areas I noted. If there's any more, then obviously we can please email them to me and we can take those up. You don't have to say that all tonight. And then, yeah, I think that's. Was there anything else that anyone wanted to put forward as a recommendation from the meeting tonight? Okay, I think I'm just going to note that it's a very difficult financial position. I think that's obvious from the paper. There's nothing that I'm not saying anything new. And I think, it's with the amounts that we're needing to find in savings and the amount that's then needs to be added to the base budget in the next financial 2024-25, it's a substantive amount, and especially we're not using reserve.